representative from German government. Thank you so much. We have representative from UK government. Thank you so much. Lastly but not least, we have representatives from Aidspdan. Thank you so much. Ladies and gentlemen, I would like to thank our donors, Germany and UK, who are behind this exciting initiative. We thank you so much. At this point, it is my distinct honor to welcome Madam Ida, the Executive Director of Aidspdan, to deliver her remarks. Madam Ida, you're welcome.
Thank you, Grace. Distinguished Auditor General, Deputy and other officials from Supreme Audit Institution, distinguished Germany and UK government representative, honorable delegate from Ministries of Health, dear partners from GIZ Backup, from FCDO, Global Fund Secretariat and OIG, AFROSAI, CREFIAF, and the African Constituency Bureau, distinguished guests, all protocol observed. I wish you all a very good morning. Bonjour à tous. Allow me to extend a heartfelt welcome to everyone present here today. It is an honor for me to have this opportunity to gather and meet such esteemed representatives once again. Today we come here for the second roundtable. It is the second one for the third phase led by Aidspdan. This is an indication for our ongoing commitment and progress since our first roundtable. We are trying to elevating our capacity to delve deeper into global health initiative and effectively address finance, compliance, programmatic, procurement, and supply chain auditing. It's not just a meeting. It is a gathering of leaders who can change the world with their idea and actions. Our journey from the outset have been marked by dedication, cooperation, and a determined commitment from the science and technical and financial partners. Recollecting our journey, we have successfully navigated 2 phases. With more than 300 auditors trained, and now with GIZ Backup Health support and their partners from FCDO and BMZ, we find ourselves in the third phase where we have been able to train more than 200 auditors so far. This continued progression speaks volumes about our collective determination. Though our journey began with a modest 8-size auditing Global Fund grant, in sub-Saharan Africa, we celebrate several more countries' inclusion, and in transformative endeavor today. We have witnessed firsthand the initiation of Global Fund audit or Gavi audit by SAIS, and our colleague here present from Global Fund and Gavi will speak more about it. The Finance, Compliance, Programmatic and Procurement and Supply Chain Audit Toolkit conceived during the initial phase is an invaluable asset for guiding SAIS in their audit processes and strengthen the governance and management of the health sector program. The toolkit have in the beginning, it was just finance and compliance and some programmatic aspect. It had, and now it have navigated and evolved with a COVID grant facet and also health financing, co-financing, so domestic financing, and reflect of we can say it has reflected our adaptability and commitment for staying relevant in an ever-changing landscape. We should also acknowledge our effort in streamlining resource mobilization for SAIS. Yesterday, we had a one-day workshop meant for guiding SAIS to garner necessary resources to ensure that our auditors are well equipped to continue their essential work. Throughout our journey, we have been supporting meaningful collaboration, which have been shown by various memorandum of understanding between our key stakeholders, And our partnership underscores the very essence of this project, which is unity, transparency, complementarity, and accountability. They demonstrate our capacity to harness collective strengths to overcome challenges and drive positive change. We are here to strategize on how we can improve our way of contributing to save life of our population, share experience, and maybe a few laughs as we remember over the unique experience of auditors during the training and mock auditing. Even for myself, it was really, we had this mock auditing exercises, and for Gavi it was special. We didn't know that we should cover ourselves because we are like, at the end of the day, going through the cold chain and trying to count the vaccine and so on. So it has been a lesson. Auditing Gavi, you need to wear, warm clothes, and no one knew that, or no one of us knew that. So, as I've just talked about what we have achieved, I can say we have been through some challenge, which was like aligning the project timeline with size calendars, and also sometimes measure the long-term outcome with our implementation windows period. Yet, every challenge we faced has only steered us towards the refinement. The horizon bring promise prospect, a future where every size is a guardian of public trust in the health sector, a future where our audit toolkits are not just documents, but dynamic instrument to change toward fine-tuning our methodology and maximize impact. So as we dive into this strategic discussion, let us remember the essence of why we are here: to uphold the public interest, to be the guardian of ethical spending, and to inject accountability into every vein of the health sector. The mosaic of perspective present today assure me that the next few days will be rich in knowledge exchange, paving the way for innovative solution and future initiative. In closing, I'm really grateful for the presence of everyone here, united by a singular vision, here to synergize, understanding a collective growth. Let us embark on this next chapter with renewed fervor, where together we can make a profound and lasting impact. Thank you, et je vous remercie.
Thank you, Ida. As I sat there, I realized there is one side that I did not mention, and they were present since yesterday. I'm very sorry for that. Sai Zimbabwe. Yes, you're most welcome, and thank you for being here with us. So, following Madam Ida's remark, we will have the pleasure of hearing from representative of the German government. You're welcome.
Thank you, Grace. Your Excellency, Auditor General Alexis Camuire, esteemed partners, distinguished guests, and dear colleagues, all protocols observed, good morning. I would like to start by expressing my gratitude to the Auditor General of Rwanda, who has kindly accepted to host this roundtable. Your commitment and efforts to strengthen accountability in Rwanda are highly appreciated, and it is with great admiration that we acknowledge the work that you have been doing. Thank you so much. I would also like to thank the Executive Director of Aidspdan, Ida Hakinsinka, and her team, who have worked hard to make this meeting happen. Thank you. And thank you also to all participants who have taken the time and traveled from far to join us here in Kigali. Thanks for being here. So, health system strengthening has been a long-standing priority for German development cooperation. We are currently among the biggest donors of multilateral health initiatives. And to reaffirm our commitment, Germany has been investing into capacity development of national health institutions and promote use of in-country systems to increase country ownership. In Rwanda, we are also currently supporting the development of the pharmaceutical sector in Rwanda. However, strong health systems are incomplete without a robust accountability system. That is why in 2018, together with a global program called Backup Health and Aidspdan, we have embarked on an ambitious journey to foster transparency, accountability, and good governance in the health sector. Since then, Aidspdan has been able to train a total of 18 countries, and as time passes, we are seeing some very encouraging developments in different countries resulting from this project. Ladies and gentlemen, as a country's pillar for integrity, supreme audit institutions play a major role in ensuring that health programs deliver quality services in an efficient manner and in compliance with national laws and policies. Especially in times of crises, SAIs can be instrumental in ensuring that fast-tracked and expedited budgets are used in compliance with rules and regulations, but also to achieve their intended goals. The COVID-19 pandemic has reminded us all of the unique positioning of national audit institutions and their huge potential to oversee and evaluate external funding. Furthermore, SAIs can engage with parliamentary public account committees, hold their government accountable, and support resource mobilization for health. Since the beginning, this project has received a lot of support by our colleagues from the Global Fund and the Office of the Inspector General, and I would like to take this opportunity to thank Ada Fay, thank you so much, and her team, who over the last years have been strong advocates for SAIs. We really appreciate your leadership to move forward the public financial management agenda at country level, but also within the Global Fund. I would also like to welcome the new collaboration with Gavi, having recently joined us on this journey, and I hope that this is only the start of a long-standing partnership. Finally, let me thank my colleague from FCDO, who have put their trust into the Backup Health initiative, and who have now also come on board to invest in this exciting initiative. So today marks the start of a 3-day roundtable gathering high-level representatives from the countries that were part of this initiative, but also from the umbrella organizations for Anglophone and Francophone SAIs, as well as multi- and bilateral organizations. The primary objective of this meeting is to learn from each other, to look and reflect on the results of this initiative, and to exchange best practices. But we should also take this opportunity to look beyond this project and imagine the future of accountability in the health sector. I encourage everyone to actively engage in discussions with peers and shape the accountability systems of tomorrow. Some countries have already shown the way, and I'm sure others will join very soon. In conclusion, I would like to say that this roundtable is really a great opportunity to continue advocating for national accountability systems, and we look forward to the next 3 days of discussions and exchange. Thank you so much.
Thank you so much. Ladies and gentlemen, allow me to welcome the representative of the UK government to provide his remark. Thank you.
Thank you, Grace. Auditors General, Global Fund and Gavi representatives, colleagues and officials from Supreme Audit institutions, distinguished colleagues, all protocols observed. My name is Rob Whitby. I'm the Deputy Development Director from the United Kingdom here in Rwanda, and I'm extremely happy to be here at the start of this important meeting. The UK appreciates the work undertaken by Aidspdan with Supreme Audit institutions and for convening national and international experts today here in Kigali to exchange best practice. This meeting provides an important opportunity to further advance risk assurance and accountability in health programming, specifically in relation to investments through global health initiatives here in Africa. Together with Germany, the European Union and Switzerland, the UK has supported the GIZ implemented Backup Health Initiative that includes funding for Aidspdan's work. Our £18 million worth of funding supports the work in 6 African countries: Nigeria, Tanzania, Uganda, DRC, Mozambique, and Zimbabwe. And I'm very happy to see representatives from many of these countries here today. Here in Rwanda, the UK has a long-standing partnership with the Office of the Auditor General, supported by £6 million of funding from 2010 to 2021. And now the UK's National Audit Office is partnering with the Office of the Auditor General to enhance performance and value for money audits, specifically in service delivery sectors such as health and education. The UK is the 2nd largest bilateral donor to Gavi and the 3rd largest donor to the Global Fund over its history. We see greater accountability and assurance as critical to ensuring that we continue to able to make these significant investments in those agencies. It's been a real privilege to be here at the start of this event and to be asked to say some words. I really look forward to the discussions over the next few days, and I hope that they will be very fruitful. Sadly for me, I'm leaving Rwanda in a few weeks to return to London, but my new position in London will be the UK lead for Gavi. So I very much look forward to the conclusions of this meeting and to taking those forward in my new role in London. Thank you very much.
Thank you. And finally, to officially kickstart our workshop, I would like to invite the Auditor General, Sai Rwanda, to make his opening remarks and declare this workshop officially open. You're welcome, sir.
Honorable Auditors General here present, delegation from Malawi, led by Auditor General Mr. Thomas, delegation from Tanzania, delegation from Zimbabwe, delegation from DRC, delegation from Nigeria, Uganda, Mozambique, representative from GIZ, representative from FCDO, representatives from Office of Inspector General of the Global Fund, representatives from the Global Fund Secretariat, representative from Gavi, representative from African Constituency Bureau of the Global Fund, Executive Secretary of Aidspdan, representative from CREFEAF, AfroSAE, and colleagues from Sai Rwanda. Distinguished delegate, ladies and gentlemen, all protocol observed, it is my pleasure to welcome you to this roundtable meeting here in Rwanda.
with the agenda, and then hopefully make it in time for the rest of us to have a tea break. So I'm just going to go very fast about how the agenda for the next 3 days that we are here is going to look like. Thank you, Sam. So the first day, we've already started on a high note. Thank you for the opening remarks from Sai Rwanda, from the UK government. Aida, thank you, from the German government. So we've already started with the opening remarks, and next we are going to get some keynote address from Global Fund and Gavi. And we are also going to have a presentation from Aidspdan, just to tell us about how it has been, the performance in terms of our experiences, and we are going to have a Q&A session after that. Then we'll move to a panel discussion where we'll delve deeper into finding out about the experiences, and we are not just only going to talk about the experiences of the project, but just to talk about what next. And then we'll move to the lunch break. We'll have some presentations after lunch from AFROSAI and CREFIAF. And then we will finish with the countries doing presentations. We've been getting a lot of recommendations, and also we've been getting a lot of suggestions that we also want to hear from the SAIs. So for those who want to hear from the SAIs, afternoon will be the day. They'll be telling us about some of the best practices, some of the challenges in their work, and then we close for the day. So the first day is generally giving us like an overview of the role of SAI in terms of our health program assurance, especially for the donor-funded projects in their country. And then for the second day, here we are going to now go into the deep, where we are going to find out more about the role of SAIs when it comes to engaging other stakeholders. So we will begin by a presentation of, from Aidspdan, talking about how, what is the role of SAIs, who are some of the stakeholders they could engage in their work. And then a presentation by CREFIAF about promoting stakeholder engagement. And we'll also hear from SAI Rwanda about some of the experiences when it comes to financial and auditing for health programs. And then we'll go to a coffee break, and then we'll have presentations from Global Fund and Gavi about also the experiences engaging SAIs in their work. Moving on, we'll go for a lunch break, and then now we'll have the countries now sharing the experiences about specifically this project, how it has been for them, what they've managed to do, what are some of the lessons, what are some of the outcomes that they've gotten from these projects ever since they were trained, what are the key lessons, and also maybe we'll also identify areas of support so that they can be maybe supported, so that some of this work and some of these outputs from the project can continue past phase 3. And then that is the third day. Then on the last day, we will begin by an interactive session led by CREFIAF. Sorry. Yes, we'll begin with a panel discussion again by Aidspdan. So here we'll be talking about sustainability. From the presentations we'll have heard about from the SAIs on the second day. So here we'll delve forward just to find out, to discuss further how can some of these outputs from this project continue or be supported to continue post the project. As you are aware, this is the second, or rather the last roundtable for the end of the phase 3 of the project. So the third day will be sort of discussing about the sustainability of the project outcome. So this is just like an overview of what we are going to discuss. So without further ado, and in the interest of time, I'm going to welcome, that would be Global Fund. Thank you so much for being here. So please welcome and give us your address for the day. Thank you.
Yeah. I would like to acknowledge our hosts, the government of Rwanda, but also the Auditor General. I always say that a host is first the country and the representative of the country. To our donors and partners from governments, to my colleagues from Gavi, Auditor Generals, ladies and gentlemen, all protocol observed. I would like to thank Aidspdan for the invitation and collaboration on this important initiative. This is close to my heart. At the Global Fund, Aidspdan is our watchdog. They hold us accountable for our results, our promises to the world through our strategy and mandate. So for them to be a champion in this initiative is also holding themselves and holding countries accountable to the Global Fund partnership. At the Global Fund, we pride ourselves with transparency, accountability, and country ownership. These are core values and principles that we abide by. And when you look at the Global Fund, I think you all agree that we're not a traditional donor. It was designed as a partnership. And our role, when I say it, people laugh. My mom once asked me, "What job do you do?" I say we are the richest beggars on earth. We go out to the world, beg money that we call resource mobilization. But we mobilize for vulnerable people and the people that we believe in. So we don't beg for ourselves, we beg for beneficiaries. And I use the word begging to bring down the aspect of humility. Because when you talk and look at yourself as a donor, if you're not careful, you think you're above people. When you consider yourself as somebody that begs for populations, then the nature of the partnership, that is when we start to make it live. Because a partnership has to be something that lives. We have to be equal in that journey. Through that resource mobilization effort, we allocate funding to countries. And the core of everything that we do is to fight HIV, TB, malaria. But you cannot fight those programs without investing in RSSH, Resilient System for Health, that my German colleague has just talked about. But how do you strengthen a system without proper accountability and assurances? All of these things are so interlinked that when we talk about them, whether we're programmatic or finance professionals, we have to look at it from that perspective. And that brings me to the role of implementing countries. Because before we talk about the Auditor General and the size, let's talk about the countries that we're supposed to serve. In my view, implementing countries own their own responses. Our partnership is about country ownership. When you have everything that you need to have, and you hold your program managers and everybody accountable in your country, I can tell you and I can assure you, Global Fund will not be a very frequent visitor in your country. Because our only objective in life is to mobilize resources, allocate it to fight the 3 diseases, and report back the impactful results from your countries. And I think I always say that Rwanda is a very good example where I think the last time I've been in Rwanda is 4 years ago. And every mission to Rwanda is a mission of collaboration. It's a mission where I come to the country to learn. I come to Rwanda to take back and implement in other countries. It is not a coincidence for Rwanda to be hosting this roundtable, because I think as partners, as donors, and as a child of the continent, we should be proud for the bar that they have established for themselves in terms of accountability, self-auditing, self-assurance, self-management. And I think that is what we want for every SAI. We don't want to be auditing you. We want you to have the capacity, to have the processes, and to have the independence for you to be able to run your own programs and hold your programs accountable for the sake of your people. As we do that, I think agility and adaptability is core. For Global Fund, when you look at how we have adapted ourselves during the COVID response, it shows that we're very adaptable. We'll adjust and adapt our programs to what you have to deliver. I always say that numbers matters. If we were to put the investment in numbers, we're a partnership that invests $4 billion across the world. And in the last 12 months, that $4 billion has increased to $5 billion, a growth of over 30%. Even the Fortune 500 countries have not grown by 30% in a year. But that $5 billion, 75% come to Africa, and the people in this room receive approximately 40 to 60% of the funding in every year. So the people in this room, you matter as well. So in that context, I think the effective and efficient use of those funds are very important. Everyone is accountable for the actions and decisions made on these funds, as every dollar matters to reach those people who, without these funds, their health and well-being, their own personal integrity and dignity, and their way of life is affected. When I go back home, I always say that these programs are generally not for people in this room, and they're generally not for people like me. Because for many of us, we're privileged and fortunate enough to be able to pay for our own health. But the millions of people in the communities and the millions of people in the continent rely on this funding on a daily basis for their lives, health, well-being, and their human dignity. As we look at performance audits and programmatic achievements, we should constantly remember these people and how the decisions that we make impact them on a daily basis. As a result, over the years, I have been, as a finance person, it's very funny, I have been a big advocate for the return to use of country system and increased use of public financial management. But there are skeptics, because when you use system of somebody else, the first thing is trust. You have to trust the system. To trust the system is not just we trust the system. We have to test it. The system has to be resilient itself, and that is why these programs, they matter. Every donor who invests in these programs, sometimes we see it as projects. We see it as workshops that bring together people. We should start to look at it as a safeguard, protection, and assurance that we're providing so that those vulnerable people in our communities get what they deserve and be dignified when they walk into the health clinics and health facilities of this continent. National accountability institutions, SAIs. Most of you have a mandate from Parliament. Parliament is the place where the population of our countries entrusts representatives to protect their lives and well-being. Your role in ensuring that health programs and health services is not only an accountability responsibility, it is also a public good. you have to provide visibility to the world. You have to demonstrate and create a high bar for yourselves and for your countries. And to that end, Global Fund is committed and continue to be a champion around increasing the use of size in the audits of our programs. Collaborating with Aidspdan in the last 5 years has been a journey. In the beginning, the room was based on fights with IDA. I say, but we are not going to do it unless they prove capacity, unless they can audit based on the bar that my donors hold me accountable in Geneva. I don't trust them because it is about trust. I always say that my grandfather and my father, they have not left inheritance worth the amount of money that I manage for Global Funds. So as I manage those funds, the bar has to be high because the world has put on my soldier the accountability that even if I were to sell the entire heritage of my family, I can cover it. So as a result, the bar is high for the size and it's very high for the people that you serve. We can ensure healthier, safer, and equitable future for our communities only if the SAIs, Auditor Generals, Accountant Generals, and governments play their part in ensuring accountability and deliver services intended for the most vulnerable in our societies. Everybody is talking about the fact that we're not going to meet the Sustainable Development Goals. I remember when I joined the UN as a young professional, we were talking about the Millennium Development Goals. It was the hope of every African child and everybody in Africa, because let's be clear, the development agenda is an agenda for Africa. When you look at the entire development funding landscape, 50–60% of the funding come to our continent. As a continent, we should acknowledge that we are not going to meet the SDGs, but we should all embrace ourselves, play our role and part to at least meet the AU 2050 and 2063 agenda for this continent. To that end, I'll close with 3 points for SAIs. I think your role to effectively drive a change in the paradigm for this continent is to improve value for money. And I always say that value for money, people define it differently. For me, it is just through optimal programmatic audits. Audit the programs to make sure that things that we have promised donors, things that our communities need, are delivered well at the right price. We talk a lot about corruption, and we don't talk enough about wastage. The amount of wastage in our programs are much more significant than the corruption that happens in our programs. So we have to fight both corruption and wastage in our programs using a value for money lens. We have to increase optimization, because I can tell you for Global Fund, we disburse roughly about $9 billion to Africa. It looks like a lot every 3 years. We spend roughly about $8 billion every 3 years. But when you look at that number, you say it is a lot. I'm going to flip it. The funds that is allocated to Africa that is not used on a 3-year basis was $1.4 billion in the 2017-2022 period, and $900 million in the last 3 years. When we look at ourselves as people who are responsible for the finances of our continent, We should not be proud, we should be ashamed. We should not focus on the $8 billion that is spent, but the 1.4 billion or the 900 million that we've lost for the continent. We should all enhance our zero tolerance for fraud and hold the people accountable. That is the point from my learned colleague, Danielle, who always say we have to hold people accountable. I'll close with an anecdote. About 4 years ago, when Global Fund introduced a cutoff period to say that when funding is not used, we return it to the country, I was summoned to Rwanda. Summoned to Rwanda. I say, okay. I came in and I met the Permanent Secretary, Ministry of Finance. And I used Rwanda, not because there are no other stories, but the story of Rwanda is extraordinary. The gentleman told me, but Ada, how can you help us to not lose $15 million out of a grant of over $300 million? They had already achieved over 99% utilization. And I say, but you're among the top performers of Global Fund. Why do you need this $15 million? The guy told me, if we lose the money, heads will roll in this country. Because when money gets into the country for the services of the people, Parliament and the President expect those funds to be delivered for the people. That is the bar. But we lose $1.5 billion in this continent, and we all go to bed, we sleep well at night, and we think we've done a good job with the $8 billion. I think this is the beginning of your journey. I want you to use this closing roundtable as a point of empowerment, as a new call of action, not for you, not for me, but for those people in our communities who wake up every day not being able to afford the cost of a paracetamol to save their children. They deserve better, and they can only get better if we hold ourselves accountable through the SAIs, and if the SAIs pushes Parliament and governments to hold themselves accountable, then this continent and the people of this continent will start to have good health, better health, and the best optimization of investments that come into this country. Thank you very much.
Good morning, ladies and gentlemen. I'm Charles Ohininyaku from Gavi, and I'd like to start by thanking Aidspdan for inviting us for the second time to this gathering. We started participating last year, and we enjoyed it very much. And we thought it was very important, given the way we progressing, to come the second time. I would also like to thank SAI Rwanda and the Rwandan government for hosting us. One thing you can be sure about our Ugandan friends is that they keep to their word. They promised us last year we'll be coming to Kigali, and here we are. So thank you very much for having us. I also want to acknowledge and thank our colleagues from GIZ and the British government. Through your support, we have seen the benefits. We have seen it through the work that Aidspdan has done, through the 2 countries that we have participated in through the Aidspdan project. We have been to Malawi with Aidspdan, and we've been to Nigeria with Aidspdan, and we can certify to GIZ and the British government that the work done has been very, very good. So thank you very much. Distinguished colleagues, SAIs, it's a pleasure to meet you all once again. And for Gavi, we look forward to further engagement with yourselves. We don't believe, like Ada has just said from the Global Fund side and from us also as Gavi, we don't believe we can do this alone. We don't believe we can vaccinate more children or meet our objectives alone. And I hope, and we hope as Gavi, that by the end of this second roundtable for us, or this roundtable, that we have some key objectives that will really help us engage more with the countries, work more with the SAIs, and also work more with internal audit to ensure that the accountability that we all require is met. Let me walk you through quickly 6 key principles of our Gavi accountability framework, which is very important. First, we respect aid effectiveness very much. And by that, we rely on and we build on and ensure alignment with existing country systems. Ada has said a lot about the fact that we want to rely on those country systems and the fact that we want those country systems to work. The second one is focus on prevention. And prevention means misuse of Gavi support, okay, through regular monitoring. But we want to monitor and prevent, but we also want to count on your work as SAIs to also alert us, not after the fact, but before it occurs, so that we can work together to prevent it from happening. We also want to promote flexibility and country ownership, and we cannot emphasize that enough. We exist because we rely on countries. We invest in countries. We vaccinate children in countries. We don't have our own children as Gavi. We rely on children in these various countries. And so we have to be flexible. And that is why we in Gavi are investing so much into country systems. And I'll have the opportunity to talk to you about that tomorrow when we do our presentation on some of the key investments we're doing. But just as a highlight, our board has been very gracious, voted money on the side to support that transition to use of country systems. And we are very much engaged in doing that. We can tell you that as we speak, based on our strategy, 50 countries are going to start receiving disbursement directly rather than go through our partners. And that is a great achievement because we are beginning to enforce those countries with what they need to be able to disburse directly through them, use their systems, and also capacitate the Supreme Audit institutions to help us monitor and audit that. We are also, through those investments, investing in what we call assurance providers. We're rolling out throughout all our countries. And when we say assurance providers, let's be clear. We are not trying to put people there to control the lives of our implementers. We are trying to put people to work with our implementers to achieve our goals. And that has been very, very clear as part of our rollout and our assurance framework. Knowledge transfer is key. It's very key to our approach, making sure that implementers understand what we want and we teach them where they fall short so that they can do that work in a professional and quality manner. We also promote mutual accountability, get into agreements with governments to make sure that we understand each other well and we speak the same language. And obviously, make sure that systems, when we talk about strengthening country systems, that we don't invest in the short term and in the long term, they backslide, like we say. And the backslide for us is when, rather than disbursing directly to the country, we end up going back to use other mechanisms. And that is not our objective. I would like to conclude by mentioning some of the key investments we're making. As I said, we are rolling out a comprehensive work with our assurance providers after we've launched an RFP in December of last year. We're rolling out our strategy to make sure that we have assurance providers in each and every country that is eligible and make sure that they are supporting with the knowledge transfer. And we are investing a lot. Between 2021 and end of 2022, we've invested about $30 million out of the pot we received from the board, and that is a huge investment. We have also signed together with the Global Fund, our sister organization, and AfroSai. We've signed an MOU, and we are working on a work plan to start implementing that. And the objective of that is really work to capacitate Supreme Audit institutions. And we expect Aidspdan to play a key role in that implementation arrangement. Also, we are planning to sign an addendum to the existing MOU between CRIFIEF and Global Fund to be part of that MOU, and also to develop as soon as possible a work plan so that that MOU doesn't become like something that is saved in a place, but that we implement it and achieve key results. And one thing that we've made very clear as part of these MOUs is we want to see measurable results. We are not just signing it for the sake of signing and making noises about it, but we want to see and we want to measure that is making a change. And that doesn't ignore the internal audits as well. We are also planning, and we hope that would come to maturity, a direct engagement with SAIs through AfroSai this December or November in Accra. And why we are doing all these is for us to understand each other better. And we hope that that will come very soon. I think we mentioned here the last time that we are also investing with the Global Fund in professional accounting organizations. And all these investments has only one objective: to help us strengthen our accountability and to work to improve the systems that countries are using and to support in closing that gaps. I would like to thank you very, very much on behalf of Gavi, and we really look forward to this 3 days of engagement and to work with Aidspdan and all of you to achieve our strategic objectives. Thank you very much.
Thank you, Charles. Thank you, Ada. So let's proceed for coffee break for 30 minutes, and then we come back. And there's also a request from communication team, SAI Rwanda. So some of you will be approached and asked to take part in some interviews being conducted by Rwanda TV. So when we approach you, we hope that it's something that you will want to take part in. I'm being reminded that the coffee break is to this door on my left. So please, let's proceed.
And just we're auditing global fund grants. We realized that time there were 8. And in that year, we size. 2 of these size were in Francophone region, that is Burkina Faso and Togo. We had 3 size that were already and fund grants, advocating for increased resources. And that's why yesterday we had we envisaged in the 7 countries. Then we are facilitating peer learning, and we did this in July during our first roundtable, and that's why we are here also for a similar activity, just to share our experiences and learn from each other. Then we had trainings. We conducted a workshop in the 7 countries, and we are also advocating for increased resources by sensitizing you on, that is size, on resource mobilization. So what are some of the accomplishments we have had so far? We have managed to document the various players that are involved in the audit and accountability in 5 of the countries. That is the Democratic Republic of Congo, Mozambique, Tanzania, Uganda, and Zimbabwe. And these reports are available at Aidspdan's website. You can then see the various players that are involved, including SAI. I'm sure you interacted with our teams while we are doing these studies. Then we did a very important activity of updating the audit toolkit for global fund grants that we started to develop in 2019. And we have included aspects of co-financing, health financing, and we have a component on procurement and supply chain. I'm sure you have interacted with this updated audit toolkit during our workshops in your respective countries. We also developed 2 more audit toolkits. That is one for Gavi, and we have a BHCPF, the Basic Healthcare Provision Fund, that is specific for Nigeria. So we have those audit toolkits ready. The various partners have reviewed them, and I'm sure we have shared with their respective size. Then we organized technical meetings and roundtable. As indicated in July, we had the first roundtable, and now we're having the end of the project roundtable. We organized capacity strengthening workshops in the 7 countries, where we emphasized on how or sensitized the various stakeholders on how to conduct financial compliance and programmatic audits of donor-funded programs, specifically for Global Fund and Gavi. And then we developed a resource mobilization guide. And yesterday we had a session for resource mobilization. We are going to share the guide with you, and I think this is an ongoing discussion. This was our schedule of the trainings in the 7 countries. We had, in Nigeria, we had 3 sort of trainings. That is for Global Fund, Gavi, and BHCPF. In the case of Malawi, as Charles indicated, we had a training about Gavi grants. But the rest of the countries, we had a workshop on audits of Global Fund grants. And we faced a few challenges. And one of them is that there was a postponement of training dates. It keeps on changing. And this was almost in every country. We had agreed during the roundtable, but I think because of the busy schedule, it was not able to stick to it. But we have tried to align to the dates you provided. Then, due to the short term of the project, the long goal that we are achieving to ensure that we add our value in ensuring that these donor-funded programs actually achieve their objective. So we are yet to get there, and I hope it is a journey that we're going to take together. And we have a few pending activity. One of them is a Gavi training in Uganda, which will be on 25th to 29th this month. We're in this session for a roundtable, and we hope to interact with you when we are evaluating the project. Thank you very much. We welcome your questions, additions. Your questions are welcome. It is either I was excellent, or you have nothing to add, which leaves us now to go to the next session. And I will leave this Madeline to take us through on what we're going to do with our panelists.
Thank you, Sam, for that. I guess maybe there were not questions because most of the people in this room were engaged in the project, and we've also been having update meetings with some of you, that's why. But we are here. If other questions come up the rest of the 3 days, please feel free to raise them. So the presentation that Sam just did was taking us through how it has been in the 3rd phase. What have been some of the outcomes, what are some of the activities that we still hope to do in the remaining time that we have. Next, we are going to have the first panel discussion for this meeting, and we are going to be joined by representatives from AfroSci, CREFIAF, Gavi, and the Global Fund, so that they can tell us how it has been. And as we delve into these panel discussions, it's an opportunity for us to assess the progress that has been made so far in the project. And the panelists that you are going to have, they also have diverse expertise. They also have been pivotal in helping this project, some as far as from the first phase of this site capacity building project when it began in 2018. They are our strategic partners, and they are going to provide insights into how it has been, their experiences. So Panelists, if you could join us so that we can begin. Global Fund, Gavi, Krefiaf, sorry, AfroSai. Krefiaf, yeah, AfroSai will join us. Krefiaf, I know you'll be in the general group, yeah? So once you are done, if there are any insights for you to add, please feel free. So thank you, panelists, and maybe for the sake of some of the audiences who do not know you, I'm going to ask you to introduce yourselves, the organization you represent, and maybe including your role. With no particular order, the person nearest to me can start.
Good. Okay. I'm Charles Ohininyaku. I'm Senior Manager with Gavi, responsible for external relationships.
Thank you, Charles. Good morning. My name is Edmond Shoko, Technical Manager at AfroSai, in charge of emerging issues in public sector audit.
Thank you. Good morning. I'm Eric Barr, and I represent the Global Fund. I'm in charge of in-country financial management strengthening and partnership.
So thank you, everyone. We have been at Aidspdan, every time we conduct activities and when we are reporting about this project, we have been telling our beneficiaries and also our other partners that this has been a collaborative project. And tomorrow you'll be hearing from SAIs who have been involved in phase 3, their experiences and how it has been. So today we are just finding out from the partners who are seated here how their experiences have been. So we'll start by each of them just giving us an overview of how it was for you then in terms of engagement, and if there were any outcomes that or maybe most significant change that you came through. Just begin with the overall. How was it for you before we delve into the questions?
Okay, so thank you very much, Maureen. I think I can start by one sentence that I heard a lot yesterday when we had the initial engagement at a personal level, because Ida and a few colleagues were telling me that I have changed a lot over the time, that my engagement with the SAIs, apparently I was very rigid at the beginning, but now I understand much better the SAIs. What it means simply is that, in fact, we need to have those forums and try to understand each other. And for me, this journey is exactly the one that I'm trying to have my colleagues as well at the Global Fund to have, to sit, somewhere to understand what the needs of the SAIs are, who the SAIs are, what is it that they can bring from a value perspective to the grants, and as well as taking into account, if you want, some of the challenges that the grants and the feeds are facing. So it has been there for a journey of understanding, a journey of partnership, and that's for me what I want to talk about. Okay.
Yeah, I think for me, I go all the way back to when I was a finance officer in a country, and we were discussing audit recommendations. And we happen to have a representative from the SAI as part of that discussion. And we projected one recommendation, and the SAI looked at us and said, but you guys, you cannot implement this one. I said, but why? He says, well, for you to implement this one, you would need maybe a parliamentary approval. And I don't think with what you've written and the responsibility you can do it. The reason why I brought this up is it really brought to my understanding and what I try to sell to my colleagues, the importance of engaging with the SAIs when we are in country. Because as donors, we go, we have certain objectives, but I think ensuring that the right people are around the table, it's always very, very important, because our grants do not only focus on a small bit, it's the health system, and health is quite a huge part of country system. So for me, I think that has really enlightened our understanding, and in Gavi also, this understanding has been very clear to us as part of our shift to use of country systems, that one key element we need to focus on is working with SAIs. It's actually a KPI. Okay, so we need to increase the number of SAIs and make sure that, like Eric said, we understand how we can start that engagement. It's one thing to talk about capacity building. It's another thing to make sure that we are talking the same language. And that is our objective. Over.
Yeah, thank you so much, Marilyn. And of course, Eric and Charles for giving your insights, which have further added to the insights that I had originally. Well, for us as AfroSci, our starting point is to say thank you. Thank you to the partners. Thank you to the SAIs, Aidspdan, GIZ, Global Fund, Gavi. All of you have been phenomenal, because you have turned a paradigm shift of understanding. When we started, we thought that the age of enlightenment was driven by nothing else other than privilege. But through this cooperation, we've learned that enlightenment is also a right for the SAIs, a right for our people, especially when it comes to programmatic audits in the health sector. I got a bit excited earlier when Samuel was giving his presentation and he was showing us the journey on how this started in 2018. I turned around and I looked for you, Ida, and I couldn't see you. I wanted to smile and say thank you, for a journey of 1,000 miles truly, truly begins with a single step. But where are we going in this great journey of 1,000 miles? We are coming from different walks of life. Global Fund, Gavi, GIZ, the SAIs. But there's one vertex point where we are meeting, and that is improved service delivery in the health sector. To date, as AfroSci, we have over 15 SAIs which have been trained in this program. Phase 1, Phase 2, Phase 3. And when we talk to our other auditors generals who haven't been a part of this program, Marilyn, they're itching. They're saying, when is our turn? When can we also get into this age of enlightenment, whereby it's no longer an issue of privilege, but rather of right? So the encouragement of AfroSci is, let's continue. Let's continue with this program. I thank you.
Thank you. Thank you for those encouraging words. And maybe if I could just take you back, because for donor organizations, there's an option of engaging private risk assurance providers to provide assurance for your grants, and you also have an option of engaging the SAIs. What is the value add for engaging SAIs in conducting risk assurance for donor-funded programs within their countries?
Thank you, Maureen. I can start, and then others, my colleagues will complement. That's exactly the shift I've been talking about initially. I was one of those, really thinking private audit firm, because that's what we're coming from. That's where, we were thinking was the right thing to do. And if you look at the Global Fund, we have approximately 60% of our grants that are managed by government PR. And our key, if you want, one of the things that we're trying to achieve in terms of key principles are around transparency, around accountability, around country ownership. But then when you have this reality, can you continue not relying on country system? And the answer is clearly no. So why the size? And I kept on telling you that we are now in the situation where we need, as much as we were maybe in that mindset, we also need to socialize, this reality with our own colleagues and partners. Why? And I think we've mentioned that quite a number of times in this conversation. SAIs hold government entities accountable. SAIs can get to areas where private audit firms will never be able to get to. They have access to a wide range of information. And in fact, there is so much that we can learn from the SAIs. If we simply look at some of the reports that they produce, from a risk management perspective, etc. We mentioned earlier that we are in a sector where every dollar matters. In the intro speech of Ada, she was talking about people not even able to buy paracetamol. Every single penny is important. And that's where we believe that, not only from a sustainability perspective, but based on the mandate of the SAIs, this is the right way to go. This is clearly for us, and very much convinced that we are, that this is the right way to go. System and policies and procedure at government level, for me, can be easily accessible by the SAIs. Private audit firms is more complicated. We also have this co-financing angle that we're talking about at the Global Fund, where SAIs and I can support, the assurance process. But I won't even focus only on the SAIs. Charles mentioned about prevention. Internal auditors as well are very key for us in that process. So where do we want to be in 5 years' time? I remember when we started this project 5 years ago, I used to say our small project is now becoming a big project, because we had, and every time I was promising to have more SAIs auditing Global Fund grants, then we had the COVID. Yeah, so I can take the fact that we had the COVID, that was kind of an impediment. And today we can see that through this journey, we have increased indeed the number of SAIs auditing Global Fund grants, and we did even more. So yes, for me, it's more about, the mandate, the ability to provide value add to what we're doing. That makes the SAIs very competitive for this process.
No, thank you for that question, and it's a brilliant question. And I think before we had some excuses that it was due to the alignment and of our grants and, so on and so forth. But I think what we have realized is that we don't engage much. So we have rather relied on the private ones because it's quicker, it helps us quickly to pay for, get the service done, and that is, we get our reports and we are happy. But like I said, as we grew, we realized that we were not getting the whole picture. And as Eric rightly mentioned, we realized that we have to do more to get a bigger picture. And how do you do more if you don't talk to the Supreme Audit institutions? They see a lot. So that strategic shift that we are having in Gavi to move to increase the size auditing our grants for the Anglophone countries, we only have 10 size, okay? For the Francophone countries, we have 0. Okay, so the journey will be very long, but we believe is the right thing to do. And this is why I think this engagement with AfroSAI has become even more important, and even Aidspdan. Because what we realized just from the 2 trainings that you did in Malawi and Nigeria, and maybe let me step back. Actually, it's funny because when we went back and we talked about Aidspdan in Gavi, they're like, who are these people? Who are these people? And we were like, oh, they support, and people went to Google and they say, but these people are Global Fund people. I said, yes, but they also capacitate SAI. I said, we can work with them. And so me having experienced, and by the way, I'm a former Global Fund person. So me having experienced, I know people were waiting for me to say that. Me having experienced working with Aidspdan, saw this idea that, look, these guys really do a brilliant job and they can really help us. And so rather than me attend the first training in Malawi, I sent a colleague of mine. And I said, no, you go. And the feedback was excellent. And now there is more demand to really work with Aidspdan, work with AfroSAI. But we don't want to stop there. We want to hear also from the SAIs. You see, we don't want to assume what you need. We also want to hear from the SAIs. And this is why, together with Global Fund, we are also thinking about this project in Ghana, where we really want to bring the sides together to have this direct engagement with them. And the reason why we want to do this is to put our issues on the table. If it's about timelines, if it's about quality, if it's about whatever we have, and also hear from them how they can help us meet those challenges. Because it's true that our grants have to be audited on a yearly basis. It's true that we want to know things ahead of time. We don't want to wait for you to write an audit report after 1 year and then count another 6 months for the report to come out before we begin to address the issues. We want to address them before. So I think we want to work with you, and we are going to invest in working with you. But I think you also have to prepare to work with us, because our requirements are very high and very demanding. And this is why we were going to the private firms, to be honest and frank. Okay, so now that we are coming to you, please don't disappoint us, because we really want to count on you. Like we say, you have bigger visibility. And I would like to call out my colleagues, the SAI Malawi. I worked very closely with them when I was a finance officer in the Global Fund. And when I met with Charles and his colleague, my namesake Charles, and we discussed my issues, the first thing they did was say, how can we be part of this? And they attended all our grant management meetings. And so they understood our grants. And they were able, apparently now you're going to start auditing Global Fund grants and hopefully Gavi grants going forward. And in addition to that, they gave us, through the SAI, they were able to talk to the internal audit to give us a dedicated team. So internal audit, was it 10, Charles? 10 internal audit colleagues were provided to then Global Fund to support the grants. And I think that is the kind of engagement we're really looking for also when we're talking about how we can move from the private to the government auditors. And even should your schedule not allow you, okay, because we know that your planning to audit and all that, at times it's a big deal to change. At least let's engage in the selection of which private firm will be auditing so that you own that report and you look at it with us. And I think that is the direction we want to go. And again, that choice was made because of the speed of our requirements and all that. But we believe with the way we are going, we believe that you can meet that dynamic. Thank you very much.
Yeah, maybe to respond to my dear colleagues, both Eric and Charles. The message that we as AfroSAI are getting from our member size is Global Fund, Gavi, we are ready. What's taking you so long? We have been trained, we are ready to engage. Can we come up with a framework that allows us to start working, and then we can prove to you that we are worth our salt? So really the sides are itching for more push and even more investment from you, which is very clear and tangible, colleagues. That's the far outcry in this room. Of course, we do have challenges as size, but we're happy with this platform because this is where we're saying, look, let's talk it out. Let's debate and have a meeting of the minds and execute for the greater good. Thank you.
So maybe to just pick up from what Eda said and also from what we've heard from Global Fund and Gavi. So we have heard so far that there are benefits to SAIs engaging in auditing these donor-funded health programs. And from Ed, we are hearing that the SAIs are ready. So maybe just to help the SAIs know, yes, there are benefits and the SAIs are ready, but what would make, I would say, what is this thing that would make SAIs attractive so that Global Fund and Gavi maybe can consider them as preferred risk assurance providers? I'm sorry if I'm putting you on the spot. Yeah, like what are some of these things that you'd say a SAIs would at least, because even I have to replace, because as part of the MOU, Charles alluded to their adding.
Okay, so first you were saying about making SAIs our preferred auditor. This is already something that the Global Fund has clearly established in the guideline. But as you know, we have to go, and I keep on saying, we have to go step by step. You know, it's not something that will change overnight. We have done, we have increased not only those auditing our ground, but we are also in constant engagement with even more size to make sure that gradually we get into that size becoming the one auditing Global Fund grants. So and tomorrow when I make the presentation, I'm sure everybody will see, you know, what we are doing in that space. I guess it is an important process. You know, the training is one thing, but what is even more important is to make sure that we have some kind of visibility as well on the ability of the SAIs. Let's not fool ourselves. Not all the SAIs have the same maturity level. I think it's a fair statement to say it as it is. And that's why we are also engaging with AfroSAI, with the regional body, because AfroSAI and KFIAF, we've signed MOUs with them. We signed one with AfroSAI already, I think it was 2018, but then COVID came and we had this problem. So we have to renew it. And we are making sure that in that new one, you know, the steps of ensuring having some more information on the SAIs ability. Because remember, what we want to do is not just saying we want them to audit us now. It's also supporting them if we believe that there are areas to increase or to improve, so that they are, from a sustainability standpoint, they get those support from us to improve prove their ability to do the audit. Whether it's for a global fund, whether it's for Gavi, it's not really the point. It's for the size to be able to deliver on their mandate. Yeah? So this is really the mindset in which we are. But it's a step approach. I think we need to understand that the demand may be high. Remember what I was saying. We also try to convince even internally to socialize those things. You kept on saying that I've changed. We need to change other people. So it's so important for this to be done in a way that people understand that they can really get value out of the work of the size. And engaging with size is not even necessarily, and I was saying that yesterday in our meeting, for them to do the audit. There are so many other engagement that size can help, global health initiatives to get assurance on. So there are those options that are open. I was in Côte d'Ivoire a few months ago with Anna, by the way, and we met with the Cour des Comptes over there, and this is what we've told them. They were going to do some assessment or performance audit in the health sector. We simply provided some input and put them in contact with the country team so that this can lead into something a bit more concrete. So it is a step approach. We need to really be mindful of that. As much as we are willing to work with the size, let's make sure that, shall I say something? Let's not get to a point where we start working with the size and then the outcome of what we're trying to get is not positive. This would be really a big problem. And for us at the Global Fund, our main KPI on the PFM work is on the side performance. And this is something that we're going to track. We want size to have that visibility, but then we have to make sure as well that we don't want to have bad results. You see what I mean? The KPI has to show progress. It has to be there for something cautiously thought through, so that the point where they start audit the Global Fund, they have all the tools and skills necessary to do it. So it's more in that mindset, really supporting the size, not necessarily for us, more for the mandate, but this will also benefit to the Global Fund.
Yeah, thank you for that. I think it's a two-way street. I think, first of all, I think the size, they do see a lot of our money in the countries. And I think it was in this forum last year that someone told me, Charles, we see your grants. We see all the vaccines that are sitting in the warehouses, and we do audit them. So I think and honestly, if another is here as well, and Eric is here, I think on average, we put in about, if I'm not mistaken, about, more than 50% of our funding into procurement of vaccines and drugs. That's a lot of money, okay? So you see those things. You see them when you audit. So even without engaging with you directly, you see it. So the next question becomes, when you see it, what happens? And I think that is where I want us to start. Because at times, relationships are built based on what we have on the table to discuss, right? And so I think I agree we have to also engage more with you. And that is one thing that in Gavi, we are putting on the TORs on each and every focal point that travels to country. They have to make sure as part of their stay in country, they meet the SAI. Even if to say, hello, how are you? And please, when they contact you, please give them just an hour. I think that would be good for us to kickstart, because I am sitting at the coordination levels, but they actually travel more often to the country. And I think what we are pushing them to do now is to get in touch with you. And please, when they get in touch with you, please pick up the phone or give them an appointment. The other way around is also, maybe before we finish this and maybe through our partners, to also get the key contacts in the SAIs. To build a relationship, you need an entry point. I was lucky to have met Charles through one of our programs, and then I met the AG and others eventually. But frankly, when we come to countries or we visit countries, sometimes we stay just for a week. And in that week, we are so bombarded with so many other stuff, negotiating budgets and stuff. And so at times, it's very difficult. But we are making it the point to make sure that we meet you when we come. That's the second is, I think you have to find out when grant negotiations or applications are being sent to Global Fund and Gavi. Okay, these are visible on our websites. We have a lot of information on our website that can tell you our cycle, what we are doing and all that. And please don't hesitate, if you don't have anyone to talk to just reach out to us, you know, because the idea is we reach out to you, but if we don't, please reach out to us and we'll be more than happy to engage. So, and then the other thing is, I think what we also facilitate is once the engagement starts, and I mean, the discussion about the dedicated team becomes complicated, but it helps if you have a process of rotation as part of that dedicated team, right? To make sure that once we build a capacity, those people are put to task immediately. And once I was explaining to a side that even if you don't get to audit our grant, okay, but you participate in some of our spot checks or participate in some of our reviews, okay, it also builds your knowledge about how we operate as donors. And it's true that certain sites know very well how our grants operate, and some, to be honest, do not have that. And that is why we investing so much in capacity building. The other thing I want to talk about is be involved. We don't have to wait for Aidspdan gathering to meet, right? And I hope with this engagement that we are having with CREFIA, AfroSai, Aidspdan, that we are going to have a forum that we discuss more. And hopefully, please bring the internal auditors on board. Because, like we said, if we don't build the pillars, okay, the pillars from bottom up, and we build it top bottom, we may fail. Okay, so as we are investing in capacity of the implementers to train them and build their capacity, we also have to go to the next step, make sure that the compliance roles are also built, and then obviously the SAIs also come in eventually to do that. But nothing prevents the SAIs from being part of our reviews, our spot checks, and these schedules we can coordinate and share them with you so that you also have visibility on what we are doing. And I think once you do that, and obviously there are other things that we had also spoken about in Accra, about some of the, how do I put it, the language in the reports, okay? It's, at times we call it, in Ghana we say it's too high level. So we have to come to a level where some of these reports can speak to our program people. Okay, the way you drive demand and appetite is when people understand what you are saying. If they take a report and what is reading, they need a encyclopedia or whatever to interpret it, it becomes very difficult. And that is one of the tasks we are talking to AfroSai and to Aidspdan to really make sure that as part of the report that you write, that it's really understandable, mitigation measures are clear, and are implementable, okay? And that when someone reads it and we go and sit with our programmatic people, because one thing you have to understand in our way we operate, we work as a support team as finance people, we work as a support team to the programmatic people. So our SCMs in Gavi or the FPMs in Global Fund are always the leaders when we move into countries, and we play a support role. So most of these people may be doctors with less financial background and all that. So how you can make us drive that demand is really that when we talk to them and they read what you've written, we are all on the same page. And that is also one area that I think will drive the demand to work with you. I'll stop here because if I go on, we'll not stop today.
Yeah, Marilyn, if I could just follow up with a question to my colleagues. I mean, everything they're giving us is truly sweet and utter honey delivery, and we love that. But there's one point that the colleagues mentioned that kind of like sent a shiver down the spines of the SAIs. You openly said that your demands are onerous. Now, we wish to understand how onerous are those demands, number one, and then number two, what investment have you put on the ground to ensure that when the piper now pipes, we will not end up hating you guys for asking what is due to you as SAIs?
No, I think the investments will come as we see results, and I think it's very important that you understand, and I think Eric made this very clear. It's a journey, okay? And in this journey, the more you become attractive, the more investments will flow. So we in Gavi like all those things, and SAI is one of those, okay? But for us to really go all out, we have to start slow, come up with a comprehensive work plan, action plan that we are going to roll out as part of this MOU. Begin to see results quickly, which means what are results? Make sure that once we are capacitating, they are beginning to audit our grants, we are beginning to see that they are participating in our missions, that they make time when we are in country to have a discussion with us, to update us on the mitigation measures, some of the things they are seeing as part of their reviews, some of the things that are coming that they want us to be aware of before it happens. You know, that engagement, that is what we are talking about. And once we begin to see that interaction with us, because like we said, we don't have presence in country. You are based in the country. So the more information and the more exchange we can have at that level, okay, the more we see the benefit and the more the investments are going to come. So the money will come. And we are not talking about money to pay salaries of SAIs, just to be clear, or no. But where we have, and you know we have certain limitations. So where we see a clear benefit and a sustainable benefit, definitely we are going to invest in it. Thank you.
Really to try to understand, and the arrangement that we have with the regional bodies for me is even the most important one. Because in their mandate, they have this capacity building. The point that is very dear to my heart is more how, as well as Global Health Initiative, are coordinating our effort and actions so that we don't have multiple demands and requests, etc., to the different sides. I think this is very important. You may have heard that with Gavi we work a lot, consolidated approach around that. And for me, that's really the code that we need to have, not only for Global Fund and Gavi, but for most of the actors in the health sector, so that we have something a bit more coordinated, a bit more aligned when we come to the different sides. And together we're always stronger anyway, so it's only the good thing to do. Okay.
So thank you. Maybe just to continue this discussion about demands and making the size like attractive and the likes. For ED, as umbrella organizations for the size, what do you see would be the support areas that the size might need, let's say, support in, especially if they are to be engaged? Because we are still not clear about what the MOU is about, like at the methodology, the countries of focus. But in the event that Global Fund and Gavi now gets into these engagements with the size, what are some of the support areas so that we can also manage the expectations from the Global Fund and Gavi side? What are some of these support areas that you see coming up?
Yeah, thank you so much, Marilyn, for that question. Look, the starting point of understanding and responding to that question with justice is to accept the position which both Global Fund and Gavi have put forward already. That is to recognize the strengths of working with supreme audit institutions as part of in-country systems. But now we are not naive enough to look at supreme audit institutions and conclude them as creatures that are infallible. There are creatures that have weaknesses. Some of those weaknesses are by design, and some of them possibly just by nature. And I think these are the areas where we will need support. It's not to say 100% Global Fund and Gavi will come and find a space, a nice, sweet space where you can contribute in line with your own mandate without breaking yourself. Of course, as SAIS, this is our journey. We cannot run away from it. And there are about 2 areas of concern. The first level is at a strategic, and the second is at a technical level. Let me talk of the strategic aspects, Marilyn. The question of independence is one that always crops up. And some say, you talk about it too much, Ed. And then I say, until it is fixed. I cannot stop. So today we talk about it again. The issue of independence with Supreme Audit Institution is not in the is not in the de jure independence aspect. If you read our mandates, they are nicely written and they give us the necessary independence to perform. But it is the de facto independence that is falling short. The ability to hire, the ability to build capacity, the ability to come up with a budget which meets the needs of the mandate. These are areas that we're struggling in. Where can you, as our partners, come in to strengthen that? The second issue is on the implementation of SAI recommendations. Day in, day out, year in, year out, we write some of the most beautiful audit reports, which are potentially impactful, but they are taken by the powers being and they're shelved. How can we together come up with an accountability matrix that ensures that audit recommendations are implemented? Of course, this is a two-way street. In as much as the SAIs want their reports, their recommendations to be taken seriously, surely their recommendations also should be serious. We cannot send flimsy recommendations and expect a whole people to implement these flimsy things. So how can we fix that? Now, on the technical aspect of things, since I've been working with the Global Fund and Gavi, I've realized that you have a very strong appetite for information. Some information which I find is beyond the size to share with you. Can we not find a point where we can meet and agree that this we can share, this we cannot share? The issue of the alignment with e-size. For us as Supreme Audit institutions, if we are to perform an audit right at the apex, just slightly under ethics, is the e-size. We have to comply with the e-size. How can we help each other to ensure that the terms of reference in the audits of Global Fund and Gavi are very much sensitive and aligned to e-size? And then lastly, this is an issue that we're battling with, the battle of the soul of many African nations, the fight against corruption. As Supreme Audit institutions, we get the sense that we have a role to play to fight corruption. But how does that role really look like? We're still soul searching amongst ourselves to say, Let's say we're doing an audit on Global Fund or Gavi, and we find corrupt practices. Corrupt practices that are probably going to indict some of the most powerful positions within the country. How do we get leverage from Global Fund and Gavi?
What is on the why to work with size? For me, this is part of it. Okay, I'll just give you an anecdote. Somebody was telling me recently in our Global Fund country team, one of them was telling me that once the principal recipient, which is the Minister of Health, heard that we wanted to involve the size, he was absolutely not happy with that. And then he was trying to block, even I think the report today, and I got it just before coming here, the report today has not been issued because there is this kind of blockage happening at the Ministry of Health level, because apparently maybe the outcome can be very terrific for the, if there's been some wrongdoing. And for me, this is absolutely one part where I think it is good for us to have the size on board. It's deterred from wrongdoings, because people will be afraid of not working as expected. Because in principle, once you detect a fraudulent, let's say, transaction or wrongdoers, what will happen with size or code account is that it will follow the process of the nation that has been put in place for this type of situation, which, unlike in the case of the private audit firm where we will discuss with the, maybe the unit that manages the program to deal with it, etc. In this case, it can go up to jail. So this is a very different situation, and for me, it is something that adds a lot to us partnering with the size in terms of making sure that those people that are working on our grants really understand the importance of making sure that they implement the right procedures and processes. You mentioned on the information to share. I agree. In fact, this is something that we can discuss with you and the size to find out what the right middle is. But let's remember, it's all starts with the trust that we discussed about. It all starts with that. And as much as we see ourselves as partners, I don't think we should be afraid to share information. We may want to have some thoughts around what to do with the information, how, the management process of this information. There is certainly something that can be done, and I agree with you in that sense. Now, when you mentioned the point on compliance with the e-size, in fact, I think, and I was just thinking that maybe one of the areas that we can work on together as part of this partnership is once we work on our internal guidelines, we can have you looking at it, reviewing it, to giving as well, what can work for you. Because today the guidelines that we issue are for all auditors, whether it's size, whether it's private audit firms. But for the size bit, is there anything that can be done that will be, satisfactory for both sides? And I think maybe involving you in the review of this process is something that can be explored.
Yeah, Eric, I think if we can do that, that would be great. And I think, but I think we also have to prioritize, because the shopping list is very long. But we have to be strategic. Don't forget our grant cycles are very short, 3, 4, 5 years. Okay, and we want things to be done quickly, you see. And as much as we want to know, we don't always want to know after the fact. You see, we want to at times catch it before it explodes. And for me, I think that is where really that dynamic engagement with you, SAIs, would be very, very important. And if we can come to that, right? And we can strategically, like I said, look at some key areas, okay? Procurement is one area that we put so much, both organizations. How can we strategically work with you to address some of the gaps we have there? Okay? And then we come to the other soft areas. But where majority of our investments are, it's when we procure these drugs, the whole supply chain, from the goods arriving in country, the storage, the transportation, in the health facilities, where at times the drugs are stored in, unacceptable manner and all that, and how we can work together to fix those things. I think those are some of the immediate priorities that we can, because those create immediate impact. You see, so as we have this discussion, yes, we have a long-term view, but in the short term, or in the short to medium term, where are some of the things? Because our audits have reported on these things almost on every audit it comes out. Almost on every audit. So before we even up the game, let's fix some of these things that have already been identified and how we can work together to fix them if they are not being fixed. And I like so much what Ed said about the mitigation actions. If what we are writing as mitigation actions are not good enough, from where you sit as SAIS, how can you help us redraft those or re-implement those to create the necessary solutions we are seeking? This doesn't need an MOU. This doesn't need, it's just having that relationship to make sure that from that angle, we can address some of these things. So we all agree there are strategic things we have to do, but as we speak, there are reports coming out every single day, reports in the newspapers, reports here and there, and let's have that dialogue. How can we address this? How can we fix this? Guys, what you're doing is wrong. I think you have to focus here. And let's begin to have that forum. I think that will be more impactful and quickly fixed. And of course, we are going to invest in the long-term things, because without that, we are not going to progress and sustain. But let's see how already those little things we can fix them and move them forward. Thank you.
So thank you. I'd like to open the floor to the audience for questions and to provide answers. Okay, please go ahead. There's a question on the first table.
Thank you very much for that very insightful session. I was listening with rapt attention and taking several notes. And let me say that I'm really happy that a lot of progress has been made working with Supreme Audit institutions. To begin with, one fundamental issue which we must address is communication gap between you, Gavi, Global Fund, and the Supreme Audit institutions. I remember in 2018, it was in this very room when I was Auditor General that I got to know how much Ghana was receiving. And I said, you mean it? They say, yes. I said, then when I go back, the game has changed. It can't continue as usual. And of course, it is in the interest of Ministry of Health to keep Supreme Audit institutions away. So I contacted my minister immediately and said, so you are receiving all these monies. No wonder you are not using government of Ghana money anymore. One of the things I noticed was because we were disallowing and surcharging the officers who misapply government money, they were moving to donor fund. So I said, okay, we are coming there. And we started. So the communication must be addressed. We must try and bring the Supreme Audit institutions on board, especially the Auditors General. You see, sometimes happy we have the Malawian Auditor General here, and we have several others. Sometimes it is not the Auditor General who comes, and at times when they go back, the messenger keeps the message to himself or herself. So the communication gap I think must be addressed. But let me be honest with you. The use of supreme audit institutions and or not using them is a matter of perception more than reality. We always assume they don't have capacity. Personally, when I was appointed Auditor General, I arrived with the same assumption that what can I do to use these people? Because I'm told public servants, excuse me, those who are here, you are not up to standard. So I was like, how can I use them? So I went in and said, let me find out what kind of human resource do I have. And I was shocked to know that we had over 150 chartered accountants in the Ghana Audit Service. And I was like, which auditing firm in Ghana has this capacity? Let's even assume that 50% of them are daft. At least it means they have 75% of people who can do the work. So I said, no, I have to use these guys. And at times, let me say, it's not only me. Donors, let's try and find out from the Supreme Audit institutions what they have. We will be surprised. Because when I put up a position that we were going to audit liabilities of the government, because there was a change in government and liabilities have just ballooned, I had a courtesy call from the donor community. I don't want to mention their names here. They said, look, your people cannot do it. We need to give it to the big four, Pricewaterhouse or Ernst & Young or so and so. They can do a more thorough job. When we finished and we disallowed the equivalent of $1.1 billion, US dollars, 1.1 billion, we cancel it. They came to me and said, how did you do it? And I said, there is no firm which can do the work that we did. We are the best to do this work. Why? Because of the mandate. You know, the interesting thing that came out at times is this. For instance, Ghana Health Service incurs an expenditure. They pay it, and the Ministry of Health also pays it. So the same expenditure is paid twice because of personal economic recovery programs. I hope you understand that term. So they use the same bill, the parent organization pays it, then the subordinate or the child organization also pays it. So the auditors general have a bigger mandate, and they see some of these things which the individual firms cannot do. One of the finest argument or the point I raise out of that is that when we finish the audit, the MDAs or the ministries, departments, and agencies were very happy. A lot of them thought they were off the hook because we could validate the procurement that they had done to say the procurement is good. And they thought that was the end of the audit. Then we got our IT people to run and scan all the bank accounts to see payment to all these people. Then we realized one of the institutions, because of the role they play in the country, I can't mention their name, expenditures sometimes have been paid 3 times. One person supplies 20 million and has been paid 60 million. 20 from here, 20 from here, and at times Ministry of Finance also pays. So we came back and said, no, you have to refund. Instead of government owing you, you are rather owing government. So I would like to say that Supreme Audit institutions can do a whole lot more. My personal view is that I always premise this on depend upon what religion you belong to. If you're a Christian, I'll say Jesus must go to the mountain or the mountain must come to Jesus. If you're a Muslim, I say Muhammad should go to the mountain or the mountain must come to Muhammad. Why don't we come out with a timetable or a plan to see how do we rope on board these Supreme Audit institutions? Yes, they are not on the same level, I agree. The majority level is not the same. But can be resolved easily by one, supporting them. 2, through collaboration. We have under the Afrosai, if you ask him, I sent auditors from Ghana to Liberia and Monrovia and Sierra Leone to go and do audit. So we have collaboration. So if you look at only one Supreme Audit institution and say that they don't have capacity, your position may be misplaced. They have other supports. And again, I want to plead with you. The Supreme Audit institutions, they have a timetable which is cast in law. their audit report must go to Parliament by a certain date. So by your small support, don't go and change that requirement and interfere with their performance and say, look, because we are giving you 1 million, stop auditing the entire consolidated fund and do global fund first. But to be very honest with you, dialogue is the way to go. Let us bring them on board, and you will be surprised with the mandate or the capacity that they have. Forget about my comment even about qualified accountants. It will shock you the quality that you will get at times from those who have not even do the so-called professional courses. If you meet them and you see their output, you say, wow. So you're able to do this. Some of them have only A-level or O-level, but they have what in Ghana we call MBA. I hope you know MBA. It's an abbreviation of Mebahache, that is, I've been here for long. So they have experience, and they are able to exert this. So these are the comments and the suggestions I want to make. But your concern on procurement, I want to talk about it a bit. Local knowledge is very important on procurement. I've seen the Big Four doing procurement type of audits for us for several years. I called them and said, do you know that you don't understand procurement? Because if Ernst & Young or Pricewaterhouse, etc., they see approval from the Public Procurement Authority to use single source procurement method, they are happy. And I said, have you read the law? The law didn't say that they should give you approval, but based upon some conditions. So if those conditions do not exist, they are conniving. They are not approving. They are conniving with the corruption. So once they took most of those decisions, I have to commission a new procurement audit, taking the findings from their reports. Unfortunately, actually, that report didn't come out because I think it could have created too much commotion in the country. The report didn't come out. I want to stop here and give space for others to also contribute. Thank you.
Marilyn? Marilyn? Only if it's okay with you. Thank you so much, Auditor General. You always come with very former. I have added former. Thank you, former AJ. Look, AJ, right now you are the most endangered species in this room, because you're the only one here who's ever been an Auditor General and can probably give us hindsight, especially on this issue of the communication gap. When you're looking at the SAIs themselves, what is it that is hamstringing the SAI from contributing to building up this knowledge gap and closing it? I'm sure you can advise some of your peers here in hindsight.
Thank you for that question. One of the challenges that I think my colleagues had, because we used to meet and talk, is the fact that the respect, and of course, I did worship my independence. And we say immediately Gavi comes in, or immediately Global Fund comes in, they start dictating to you, forgetting that you are independent. And I say, independence does not mean you don't share ideas or get advice from people. That is not what independence really means. They're just giving you support. So that's why I talk about the knowledge gap or the communication gap. So it is for us to go in and let the Supreme Audit understand that we are not here to take away your mandate. We are not here to dictate to you. We just want to benefit from it. And you can also benefit from us, because definitely you may have some international experience. You may also have some technical know-how, which the Supreme Audit Institution does not have. So it is a matter of perception and fear. My father used to tell us that if you meet an arrogant person, somebody who will not like you to talk to him, is because he or she is not knowledgeable. A knowledgeable person will like to interrupt and engage. But if you say, stop talking, it means you are going to say something which you can't respond to wisely. So it's better shut you up. So we should try and engage. And let me also say that it's a culture within the fraternity, the accountancy practice. You know, it is believed that if you are doing your audit, you must be alone and do your own thing. Close the doors, nobody should hear, etc. But the Supreme Audit Institution is not an island. And I tell them that even islands have got connecting flights. And at times there are boats which even cruise in between them and the mainland. So we need to interact with each other, especially with the increased knowledge and technology which we require. If you decide to make yourself an island, you'll be left behind. So please, my plea to address the issue is to bring them on board. Let's have a session with the Supreme Audit Institutions when they have their annual conferences. They normally have annual conference which you organize. Yes, get a space there and meet them, maybe some 2 hours, and address their concerns. That this is what we are about. We are not here to take over from you. We can support you. You can benefit from us as we also benefit from you. Thank you.
Thank you so much. These are very exciting discussions. I'm already seeing again some hands. Yes, Omeswe, go ahead.
Okay, thank you very much for the exciting session, and thank you for the senior colleagues' contribution. My name is Omeswe Chukwudike from Sai, Nigeria. Yeah, my contribution is still to re-emphasize what the last speaker, spoke on. Most of the countries, yes, we know we are on different maturity level, but there are things that we can do because in our traditional role in audit, we see most of these things. Like this Wambo procurement, for example, you can see a situation where from Global Fund, they are paying for the clearance, and from the budget, the national budget, they are also paying for the clearance. But because this relationship has not been firmed up, most of these reports may not get to the Global Fund or the details. We may not go into the details, and we just handle them superficially. And our report goes to the Parliament, and they may not have the in-depth understanding of what we are talking about. So actually engaging the size will, give more impetus to the visibility and the comprehensiveness of the reports. Secondly, I want to make a suggestion on how to actually bring up this size and firm up this relationship. Yes, their engagement might be country by country, country-wise. It is fine, but I believe a better engagement if Gavi and the Global Fund will establish what they call maybe Board of External Auditors of SAI, where the Auditor Generals of SAIs that they are using will become part of the board, because when you look at this engagement, you see that most of the participators of this engagement are not the Auditor Generals. And by the time you go and give a feedback, it will not be the same for them hearing all these issues from the funding entities. So if such a board is established, maybe you have a secretary to the board who coordinates and gives first-hand information and also drive in the expectation of this size. The Auditor Generals will buy this and take these issues very, very seriously. From that central coordination, I believe much mileage will be established. Thank you so much.
Maybe, sir, can you are you saying we donors should be part of the board of the Supreme Audit or vice? Can you please clarify that?
Okay, the donors now, which is Gavi and Global Fund. By right, they are the, from what we are doing, they are the ones that's supposed to establish, ensure that these audits are done. Because by the Constitution, for example, Nigeria, we don't have power to audit private entities. It is only government entities. But through assurance engagement, agreed upon engagement, SAI can be asked to audit PROs that are not government. So the board we are now talking about, assuming at the Gavi and the Global Fund level, they establish what is called Board of External Auditors of SAIs. Okay? From there, they can invite the Auditor Generals who are members of this SAIs, and the engagement starts from them, from that up. Then for us, who are the foot soldiers, whenever we make our recommendation or we bring our proposals, they are already having a full understanding of the requirement, and it will be easier for us to sail through. And another point I want to make is for you to understand that Nigeria has moved a bit further from where we were. A department has been established because of this Global Fund and Gavi, because it was rural. Before it was under just Auditor General, and whoever he wishes, he asked to, attend or handle Gavi Global Fund issues. But now a department has been established, and we ensured that the director of the department is part of this meeting, so that at the senior management level, issues of Global Fund and Gavi can be discussed and taken seriously. Thank you.
Thank you. Maybe reactions about the recommendations, especially on the Board of External Auditors of SAIs. Just initial thoughts about this. Is this something that could be feasible?
Our CFO.
Ada, over to you.
Thank you. Of course, the easy answer is yes. There is but as Daniel say, I think we all have to acknowledge and agree that it's a transition, it's a journey, and we have to start somewhere. The value chain of assurance is huge. There is procurement, there is co-financing, there is a lot of due diligence audits, there is the financial audits. What we need to do with every SAI is at least to have a landscape of who are these SAIs force, who are these people, have an engagement with them, understand from their own value proposition what can they do immediately, and then start with that and evolve until you get to a place where they become your one and only assurance provider in the country. And I think if we operate, when we were in Cote d'Ivoire, we realized that we couldn't give them the financial audit immediately because we've committed with the private auditor already. However, because they were doing the health sector audit, we told them you can integrate and do a co-financing review within your audit, which will start to create sort of a relationship. You create relationship, but also appreciation of what the SAI brings to the table. And I cannot agree more. And sometimes I even wonder, how did we get to this place? Because in many countries, the law is that the Auditor General needs to audit. but we are already in the place we were not supposed to be. Now, how do we progressively get out to then work with the countries and get in place? It has to be a journey of progression. I'll say yes. We can commit to do something with every side. What will be very difficult is I cannot commit to do everything with all sides, because it has to be a journey of trust. It has to be a progressive approach where we let go of what we're doing progressively and also get our stakeholders to buy into the approach. Over.
Wow, yeah. Thank you so much, Ada. Always getting seminal inputs from you. I even wonder if maybe I shouldn't even contribute without watering down what she said. But if I do water it down, forgive me, colleagues, that's not my intention. But look, I just want to support exactly what you're saying, Ada. And in line with the idea that we're getting from the colleague from Nigeria, when I listen to what he's saying, I hear the principle more than the structure. The principles that he's talking about are very key. We need to have some form of oversight. We need to have some form of engagement, some form of collegial way of how we can move forward. Maybe we can debate on the structure another day. But let's think about what Ada has been saying. Already the structures that we have, what do we have that is satisfying the principles that this idea has to go with? And I think it's a good debate for us to have following forward. And we look forward to engaging further on it, isn't it, gentlemen, on this matter? Yeah, thank you so much for that. And thank you, Ada, for your wisdom.
So thank you. Any more questions, reactions from the yes, please?
Thank you very much for the contributions and the panelists. I think my contribution or comment, anyway, my name is Thomas Makiwa. I'm the AG for Sai Malawi. Is to do with what they call pistaphobia. So this is the fear of trust. And sometimes I wonder when we meet, we feel like we are comfortable with each other. But practically, there's a lot of mistrust. And there's no one who is going to take us out from this crossroad. I think the former AG for Ghana has mentioned it, that I'm sure we should move out from the issue of trust. We have got the capacity and we have got the structures. And I think we just need to move on. Sometimes I wonder when we don't get the same fear with the big fours. Because some of us who have dealt with them, and we have got a fear of trust with them as well. So I think when the Supreme Audit institutions are giving you this comfort, get it right that trust us. Because we have got all the battalion of people, we have got the mandate, we have got the knowledge. I should tell you that for me to get information from any person in Malawi, it's just a matter of a subpoena, which is a letter which I can write to a bank. But a private firm who have challenges to get that information if they're auditing any public resources. So why do you go the longer way when the easiest way is just around the corner? The second issue is to do with within the same mandate. Our audit reports eventually reach Parliament. I had an experience where a private auditor audited the CDC funds, and the American government wanted a refund. And the government of Malawi said, no, we can't refund you. Let the Auditor General audit, so that when we are refunding, we have got the assurance that indeed it was a legitimate expenditure. So you can see what is happening. It's just another expenditure of an audit. So some as institutions, they've got access to information. For me to call the minister, to call the ST, it's just a call. I don't think an engagement partner of Deloitte can call a minister by just a call. There'll be protocols. And in the protocols, I don't think they could even make it. So I thought that we have discussed.
Thank you, Auditor General Malawi. Yes.
Basically three. It's just a contribution. One is the form of question and engage civil society. One example in Uganda whereby the media went on a name and shame of health facilities showcasing whereby they don't have drugs and all that. Now you can imagine the impact on Ministry of Health. But for us also as a SIASAN, that was an opportunity to focus on what? On those areas. That is a question or a suggestion. The second one is on the monitoring systems from Gavi and Global Fund. When you come to assess the country systems in terms of implementation of these programs, yes, you are indicating that you are now engaging the SIs into oversight, but mine is keep those monitoring systems in place because an additional independent eye does no harm. For example, I cannot tell myself how good I am. It takes another party. But when you come, please call on the SIs. I've, at least this year when there was a mission from Global Fund, after assessing the health agencies, they came to the Auditor General and had a chat in terms of perspective as to how we're having oversight. The same with Gavi. And then, of course, with the other one of getting the size to partake in oversight of these programs, I think you are late, but better late than never, because the Auditor Generals have, in terms of their mandate, unfettered access and know so much about what is happening in the health system than their external auditors really do. And then, of course, as I said, I will also resonate that it's more of a perception, because these firms or the people who studied there are the same as really the staff. They've studied in the same university, even done the same courses. But of course, with the level of experience, I think the oversight, really, if you engage Auditor Generals directly, I think that will be done. But maybe lastly, the other issue is on the reporting requirements, because Gavi and Global Fund have their reporting requirements. But also, I want to indicate that with the experience that we have in oversight of health systems, but also in financial audits, is that now in terms of really assessing delivery of healthcare systems, I think the answer is moving more away from financial and compliance audits to more of performance and more of now the programmatic. And of course, they are costly, and we appreciate Aidspdan for this, but for SAI Uganda, because we have been involved in that, really we're able to have an opportunity of really following up the extent to which these health delivery systems are working. That is all that I had to share. Thank you.
Thank you, Charles. Oh, there's another. Ada. Okay, Ada, please go ahead.
And thank you very much, especially to the AG of Malawi for the comment. And I think it's important to clarify. I don't think it's a problem of trust. It is a problem of putting in place the necessary framework to do the transition. And maybe I was not very clear. We are in the wrong place, and I don't know how we got there. how did we get to a place where a donor comes to a country with the Auditor General with the mandate that they have signed by Parliament, and a donor decides who audits? I don't have the answer to that. And I don't want us to debate that. But that is where we are. Now, to come out of that, in this room, we've all acknowledged that all sites are not the same. That is number one. Number two, most of the sites in this room, some of them, you are already auditing global fund programs, many of you. The ones who are not, who require capacity, I agree with Danielle, we can use other SAIs to help them through a peer review. That requires some framework agreements and some other form of legal framework with IntroSci, with AfroSci-E, with the regional and global bodies to be able to facilitate that peer review. Through this initiative, we have signed, this year, we have signed about 8 MOUs, and we just finalized the signature of the MOU with AfroSci-E. The latest one that we've signed is with CREFIAF. So what we are doing is putting in place the legal framework for an accelerated transition. However, I think Global Fund, Gavi, countries, CCM, ministers of health and ministers of finance, we all have to be jointly responsible and accountable for how we got to where we are. And now how we get out of it, that is the journey we've all been in since 2018 with Aidspdan to try to manage the transition. Every donor fund, I was trained and started my career in the Ministry of Finance. I am the biggest advocate for the sites to audit. But if I sit here and provide a commitment to say that now Global Fund, all of the sites will audit Global Fund grants, I will not be truthful. So it is not a problem of trust, it's a problem of transition. And through that transition, it is those sites that are auditing who should be the first champion and the first advocate. Audit on time, produce quality audit, so that the debate itself around the capability of the site should be off the table. Because I don't think it's an issue of capacity. It is an issue of perception, and I don't want to name the countries. I have been myself in countries where the last audit report of a country is 5 years ago. The last audit report of the health sector of a country is 5 years ago. The last audit report of the education sector is 6 years ago. Now that is not a narrative. So how do we get to a place where leveraging what we already have, showcase that, and you help us to accelerate the transition? But let's not make it a trust issue. It is more of a transitional arrangement, and we are doing everything we can with the framework agreements we are signing, and even with the commitment that we are making in participating in all of these forums, in getting to know the sites better, and in engaging. I think if that is not our illustration of commitment, please tell us what else do you want us to do, because from where I sit, we're very committed and engaged to drive this transition. But it cannot be a big bang approach where from day one to the next, we change the clock, because every site is not the same. I just wanted to articulate that. Thank you very much.
Thank you so much, Ada. Maybe just to bring us back a bit, there was a question about the engagement of civil societies and how Global Fund and Gavi does that, and civil societies including the media. Yeah, please go ahead, Eric, and then we'll hear from Charles.
Yes, thank you very much for the colleagues from Uganda. So maybe just to emphasize the fact that one of the main things that we are doing, to buttress what Ada was saying, in all the countries where we have put in place at the global fund level what we call the SAI protocol engagement. So you will engage with all the global fund will engage with all the SAIs, that's for sure. You know, I simply wanted to understand that this is where we are at. There's a lot of things that we do. Now, civil society. Civil society is one of the areas at the Global Fund, you know, that we're working on. We have a project that is called CoLink, and one of the main area of this project is exactly to work with, at the community level with the civil society, and to see how we can leverage and also support them in the capacity building. So we are in contact with the Institute of Civil Society of West Africa. One of the things that we want to do as part of this new cycle of strategy is to start with them kind of as a pilot, to really understand some of the areas of collaboration that we can have in that space. And go at scale after that. But clearly an area that is very specifically noted in our strategy. Should I go to other, maybe, because there were a few questions on engagement with size and reporting requirements, maybe? On engagement with size, just to reiterate what I've said, it is a systematic approach for our in-country teams when they go in country to engage with size. And this has been the reason why there's been this spike in, if you have to compare to where we were over the past 10 years, in new size auditing global fund. One of the comments that I got as well as I was preparing for this meeting was, one of my colleagues was so pleased about the engagement that they have with a few sites, especially in the country. I'm not going to name the country here, but it was such a good engagement. The person was saying that the sites were so eager to continue this engagement, to make sure that, you know, we have those communication channels being established, making sure, therefore, that they were even asking this country team to do the programmatic audit that they've learned in those trainings. You know, we went obviously the way of the financial audit, but we will get there. So just to say that this engagement with the sites is really at the heart of our communication with the country. And tomorrow when I make the presentation again, I will tell you about some of the pillars that we put in place around size engagement. But direct engagement is one of those. And then on the reporting requirements of that we have, yes, I think, for me, again, this is one of the areas where, as the donor community, we should do some more effort. It is, again, remember the call that I was making earlier, is we have to harmonize a bit more some of the way we're working to ease as well the relationship with the countries where we are. Align on a few things. I don't know if you've heard about this international reporting framework for non-for-profit organization that is being put in place. We're working with a few partners to see how we can get to a place where we leverage a standard in terms of reporting for non-for-profit organization. But I mean, that's probably a different conversation. But yes, we are there. We want to really align and make sure that it is the conversation and the engagement with the countries.
As time has flown, I know there are still some, these discussions will continue. We are still here for the next 3 days. I'm just going to ask Ed to give last words, and Charles, and then we can break for lunch.
Great. Thank you so much, Marilyn, for guiding us so well. Of course, once again, I started by saying thank you as Afro-Sai. I wish to close again by saying thank you. From a legal parlance, we've got a term, pacta sunt servanda, which simply means the sanctity of a contract or an agreement should be upheld. We're in this room not for the first time, to meet and agree. And all these agreements that we're going to make, let us then go on and do what we've agreed to do. I thank you.
No, I just want to thank everyone and for the rich conversation. I think we've also taken a lot of notes. We hear you loud and clear. We know we have to, and I like the point about communication and the fact that we also need to engage, and we'll do that. We have actually started doing that. And we hear you very clearly that you have enough capacity, and obviously we believe that. And I believe you've also heard where we are. But I think in every relationship, we have to start somewhere. And so I think for me, the objective really this year is to say, if we can come next year and say, we were able after this meeting to do even one thing that we can all point to. Not the Aidspdan training, that is established, but where we can come and say, through this dialogue, we have been able to improve or engage an SAI to work with any of the two entities or to address a particular issue in that country. I think that would be really a brilliant stuff. So this is a challenge to all of us, that next year, when we come here, we can all agree to point to one thing, not two, one. If two, even better. To say that through this, we've been able to achieve this, because I think we all agree there is a lot we can do together. And to back Ada's point, why we've not done it until now, let's give that to God. But now we have an opportunity. We have an opportunity to prove that we are able to do that, and we can do something. So for me, that's the challenge I'm throwing out there. Next year, let's come out here and point to one thing that through this engagement we've been able to achieve. And I think that will make this even a bigger forum in the future years. Thank you very much.
Wow, I'm not even going to add anything on top. But let's give our panelists our thank you. Let's appreciate them. Thank you so much. Thank you for your time. Thank you for your expertise on this subject, and thank you for agreeing to sit on our panel. And with that, bon appetit.
We're friends again. Thank you so much. That was wonderful. Please come in the middle. Yeah, come in the middle. Let's take otherwise, you have to panel. No, we're friends. We're always friends. Yeah, yeah. Ask each other tough questions. One more. Thank you. That was fantastic.
That was wonderful. Very nice. Very nice. Oh, it was great. Very nice.
Discussion. Thank you.
That's a brilliant one, because it's also part of the presentation, and what we encourage is AfroSAI to say, to make sure that they also incorporate them in their strategies, because if it's not written down, then how are we going to account on that? So that was an interesting discussion. Anyone else? My friend Charles, who did you meet? I'm putting you on the spot. Because you always like to put me on the spot.
What is the question?
Who did you meet?
That beautiful lady.
Sorry?
That beautiful lady from Rwanda.
From Rwanda? Mm-hmm. Oh, okay. All right. Let's see the beautiful lady from Rwanda. It's Sophia. Oh, yes, it's Sophia.
Yeah.
All right. Great. I think as we started this morning, I was sitting and listening to the discussion that we had, right? And it just got me thinking to say, like when you started with this project, Ida, in 2018, and I was realizing how far we've come. And when they approached us as AfroSci to say they wanted us to collaborate on phase 1, we thought it was just one of those one-off projects, you know. But then we realized over the years, over the past 5 years, to say the commitment and the passion that the team has shown in making sure that they mobilize the resources, that we don't only have phase 1, we also had phase 2 and phase 3. So we really want to say thank you, Murakoza. And with the Global Fund as well, and Gavi, I think our collaboration is really, really working out. And I was even thinking when we're looking at phase 1, I think we had about, the sites that are represented here, I think Malawi and Rwanda, the host themselves. And some of the experiences that we've shared over the past few years. And this morning, as we're listening to the panel discussing in terms of the sites that have been able to also be able to conduct the Global Fund audits. Like when you look at our member size, out of the 26, we've got about 15, if I'm not mistaken, that have been able to conduct Global Fund audit. So I think we really deserve a pat on the back. All right. I think for this session, it's just to re-emphasize, and I think when we started with the project as well, some of the expected outcomes, if I remember clearly, same, was to make sure that we increase the number of sites that are going to be able to audit Global Fund. And I think we managed to do that as well. Maybe in terms of the presentation, I was just asked to re-emphasize in terms of our role as size when it comes to Global Fund audits, to say what is it that we can do to make sure that these audits that are being conducted are of a high quality. We've had the discussion this morning, right? Maybe before we go there, can you move the slide? Can you move the slide for me? Okay, all right. Maybe to start off the presentation, it's good to reflect to say, as AfroSci, like in terms of our whole existence, basically we want to build capacity to make a difference in the performance of size. That's our whole existence. And how we do that is to make sure that we build capacity in our size, and not just us as a secretariat. We're a small bunch of people, but we need the size as well because they've got their own capacity in making sure that we also disseminate the information to the rest of the size. Then in terms of our core values, obviously we strive to be professional, innovative, and collaborative. And I think when it comes to collaboration, we cannot emphasize that even further, right? Then speaking of the role of us as size when it comes to the donor-funded project, right? I would like us to look at this triangle, just to remind ourselves. Right at the center, right? We say the sides want to make a difference in the lives of the citizens. And this speaks directly to what we are doing here for this project, because at the end of the day, we want to move not just from the financial point of view, but we want to go further in making sure that we are touching lives. So when we are talking about the issues of people receiving the treatment, TB treatment, the ARVs, it's not just about the financial statements being fairly presented, but we need to make sure that we take it further to see if those beneficiaries are able to get the treatment that they deserve per the grant regulations. And when you look at this triangle, it has 3 pillars, right? Right on top, we talk about the issue of strengthening accountability. And I remember when we started with the conversation to say, when it comes to the issue of the audits, right, was that when you looked at the private firms that were doing the audits, the challenge was that the reports are not being discussed in Parliament. And that's why we wanted to have the size coming in so that those reports can be able to be tabled in Parliament. And that's how we're going to be able to strengthen accountability in the public sector. Then I'll talk more on the next one. I think this first part, I think we've exhausted that part when it comes to the site independence. Ed spoke about this to say, as the size, we still need to be able to hire and be able to also manage our own budget. So what is it that we can do to be able to also safeguard our site independence? And the way to do that is to make sure that within the mandate or the legal framework that we have, what is it that we can do to make sure that we still remain independent and we are able to fulfill our duties as per the Constitution? And then on the issue of holding our government accountable, as I mentioned, to say the main issue or the biggest cry when we started with this project was to make sure that the reports that are being tabled in Parliament, they are able to see those results, especially the people on the ground, when you are able to hold them accountable when it comes to these reports. And I remember this morning we even spoke about the issue of the reports to say, we're not just recommending, right? But we need to make sure that those recommendations that we come up with are not just fluffy recommendations. And I like South Rwanda because they've been very big when it comes to root cause analysis, even from the financial audit perspective. Because I know sometimes we get the question to say, we're issuing the same recommendations year in, year out, but our auditors are not implementing. Maybe it's time for us to also look back and say, maybe what we are recommending is not as actionable as it should be. So when it comes to the root cause analysis, it's going to help us to also look into the real cause of the problem. And as I mentioned that for South Rwanda, I like the fact that they've also introduced that in their financial audit to make sure that when you are coming up with the recommendations, it's the recommendations that the PAC or the auditors are able to implement. Then when you look at pillar number 2, I like this one. How do we then demonstrate our relevance as size, right? And for this one, I think we can relate more to this one because we need to ask ourselves, are we able to meet our stakeholders' needs? As we are gathered here, right? Global Fund has its own needs, Gavi has its own needs. But then how do we then make sure that we meet those needs? Because we understand that the needs will also evolve, right? So as the size, we also need to respond to the environment that we are being faced with. And then we also spoke about the issue of communicating with the stakeholders. You know, when we started with the project, right, and Global Fund was introducing their requirements, right? And in terms of the key stakeholders, when they start the presentation, of which I think is very important to understand from the circle who are some of the stakeholders that are involved. Because if you do not understand your stakeholders, how you get then going to be able to meet their needs. And I think even when we are starting with our audits, we need to make sure that we sit down with our principal recipients, sub-recipients, CCMs as auditors for us to understand the audit process so that we are able to make informed recommendations. Then the last one, I know the auditors that are here, they don't like this one, right? Being a model organization through leading by examples. Especially for us to say, you know, as auditors, we don't like to be audited, right? When the tables are turned, isn't it? Huh? We always argue, right? So I think with this one, it also teaches us to be able to show some transparency and accountability in our reporting process. And what we encourage as AfroSAI is for SAIs to also report on their own performance integrated reporting. And in that integrated reporting, to also show the audit report, the audit opinion that we received as a SAI. We're always preaching about clean audit opinion, but we also need to make sure that our house is also clean, isn't it? Isn't it? So we also want to encourage that as the SAIs, we also need to lead by example. And I think when it comes to the last principle on capacity building through promoting learning and knowledge sharing, that's why we're here. And as we get that here, I think we can use this platform to also share experiences. I think this morning we even spoke at length about the peer reviews. That for the SAIs that are already far ahead when it comes to the Global Fund audits, we can share the experiences as well. And then lastly, just to re-emphasize, to say, as SAIs, even the UN recognize our role as SAIs in making sure that we also make an impact in our citizens, because at the end of the day, it centers around making the difference in the lives of the citizens. And I think especially when it comes to the performance auditors, will also remember, when it comes to the SDGs, I know most of us, of our countries, they subscribe to the Agenda 2030. And what is it as SAIs that we are doing to make sure that we achieve those SDGs? Okay, so that's what I wanted to sensitize us, or just to re-emphasize in terms of our role when it comes to the global initiative initiatives, when it comes to the donor funds. And maybe at the, I think when we, just remind me, Ida, I think when we started as well with the project, we had set ourselves the targets, right? And some of the targets or the expected outcomes, as I mentioned, was to make sure that we increase the number of SAIs that audit the Global Fund, right? And I'm hoping that with rounding off the third phase, hopefully we're going to be able to increase, you know, a number of SAIs in terms of our membership as well. Since we are sitting at 15, we want to see ourselves sitting on 26. Yeah. All right. So that's what I wanted to share with you in terms of the role and what we have come so far when it comes to this project. And with that said, I would like to say thank you. And yeah, let's continue with the conversation and the engagement. I think for tomorrow as well, we will hear from Global Fund and Gavi and the SAIs, because we are here because of you. So let's just try and share experiences as well. All right. Thank you.
Thank you, Nikki. Just to continue on hearing about the role of the umbrella organization and what they facilitate or do with the size, I welcome CREFIAF to have a presentation about challenges that size face. And yes, welcome for your presentation. Thank you.
Bonsoir à tous. If my English was good, I would have spoken English, but it's not good, so I speak in French. And then I'm a representative of CREFIAF. We in CREFIAF we are speaking French and Portuguese and Spanish. So I speak in French, sorry. Merci, je suis Patrice Enama, je suis directeur adjoint secrétaire du CREFIAF. Le CREFIAF, c'est le pendant de la FROSAI au sein de la grande famille de la FROSAI. Il était question pour nous de vous parler des défis et des opportunités en lien avec l'audit des programmes de santé par les ISC. Je voulais commencer parce que ce matin, j'ai écouté attentivement les uns et les autres parler et je voyais toujours quelque chose qui revenait en fond. C'était la connaissance des ISC. On ne connaît pas bien les ISC. Notre ami de Global Fund l'a répété, il a dit il a pris du temps pour comprendre comment fonctionnent les ISC. Donc je voulais, dès le départ, m'arrêter sur ce qu'une ISC dans le contexte de la FROSAI, de façon générale. Donc, ce sera mon premier point, le contexte africain des ISC. Le second point portera sur les défis et le troisième portera sur les différentes opportunités que nous pouvons saisir pour vous accompagner, pour pouvoir auditer les programmes financés par nos différents partenaires dans le domaine de la santé. La FROSAI, comme vous voyez, pour certains ne le connaissent peut-être pas, c'est une organisation africaine qui regroupe toutes les institutions supérieures de contrôle des finances publiques. Elle a à son sein 3 grands sous-groupes. On a la FROSAI A un peu plus en haut, qui est constituée des ISC de langue arabe. On a la FROSAI I qui vient d'intervenir tout à l'heure, qui comprend les ISC de langue anglaise. Et on aurait pu appeler la FROSAI F, mais ils ont choisi le nom CREFIAF, qui est le regroupement des ISC d'expression francophone, lusophone et hispanophone. Dans cet ensemble, on retrouve, et il faut le comprendre, c'est ce qui détermine les approches. Parce qu'en fonction du type d'ISC auquel on a affaire, l'approche de nos partenaires doit également être différente. On ne peut pas avoir une approche globale en fonction de toutes nos ISC. On a, par exemple, au sein de la FROSAI, on a un type d'auditeur, on a un type d'ISC qui est le bureau d'auditeur général. Ça, c'est au niveau de la FROSAI. Ils ont un fonctionnement qui est différent, qui est peut-être plus flexible que nous autres du CREFIAF. On a, au sein du CREFIAF, on a 2 types d'ISC. On a les cours des comptes et on a les inspections générales d'État. Au sein des cours des comptes, on a également un fonctionnement qui est différent du fonctionnement au sein des inspections générales d'État. Donc les approches doivent être bien ciblées, les mécanismes d'approche et de mise en œuvre des différents programmes au sein de ces ISC doivent tenir compte de ces particularités-là. Au niveau de la FROSAI I, on a le bureau d'auditeur général qui a un lien particulier avec le Parlement, qui dans son sein est au premier niveau composé d'experts comptables. C'est au fur et à mesure qu'ils ont évolué, qu'ils ont commencé à intégrer les autres qualifications. Par contre, au niveau du CREFIAF, nous avons les cours des comptes. Dans les cours des comptes, nous avons les magistrats. Mais ces magistrats, il ne faut pas les prendre au premier, à la lettre. Ce sont des magistrats d'ordre financier. Ce n'est pas les magistrats du judiciaire. Parmi ces magistrats, vous allez trouver des inspecteurs des impôts, vous allez trouver des ingénieurs, vous allez trouver des médecins, vous allez trouver tout le monde à l'intérieur. Mais on leur donne le qualificatif de magistrat quand ils entrent à la cour. C'est le même mécanisme qu'on va trouver au niveau des inspections générales d'État, dans lesquelles vous allez trouver tous les profils. On peut avoir des experts comptables, on peut tout avoir à l'intérieur. Donc, il faut comprendre ça. C'est ça la légère différence avec les autres types d'ISC. Mais à la fin, tous ont une base commune de travail qui est l'audit. Que vous soyez du type bureau de l'auditeur général, que vous soyez du type Cour des comptes, que vous soyez du type inspection générale d'État, vous avez exactement la même base de travail qui est l'audit. Et c'est ça qui nous intéresse ici aujourd'hui. Mais en plus de l'audit, les autres, au niveau du CREFIAF, ont d'autres travaux. On a par exemple le jugement des comptes pour les cours des comptes et on a par exemple également la sanction des ordonnateurs pour les inspections générales et certaines cours des comptes. Donc, ils vont au-delà de l'audit, qui donne un surcroît de travail à ces différentes organisations. Mais à la fin, qu'on soit cours des comptes, qu'on soit bureau d'inspecteur général, qu'on soit bureau de l'auditeur général, on finit toujours par avoir besoin des experts thématiques. C'est ça qui me permet d'embrayer sur les défis. Quels sont les défis auxquels nous sommes confrontés? Quels sont les défis qu'on faut relever? La table ronde de ce matin a permis de mettre déjà la main dans ces défis-là. Parce que chaque partenaire qui était sur le panel essayait de dire de quoi ils ont besoin, où est-ce qu'ils veulent partir. Bon, moi j'essaie de regrouper ça en 4 niveaux. Le premier défi concerne le mandat. On a tous le mandat d'auditer. Nous avons tous le mandat d'auditer. Mais nos audits ont une façon d'être programmés. Quand il faut mettre l'accent maintenant sur le domaine de la santé, il faut que nous changeons notre façon de programmer nos audits. C'est pour ça que j'ai mis dedans, le premier défi, c'est de mettre la priorité sur le domaine de la santé. Donc, on peut se dire, de façon pratique, chaque ISC trouvera comment le faire, mais on peut se dire que chaque année, chaque 2 ans, il faut mettre dans le programme d'audit d'une ISC un programme de santé qu'il faut auditer. C'est un mécanisme, on peut prendre d'autres. Mais il faut déjà que les ISC prennent conscience de ce défi-là, qui est de prioriser l'audit des programmes de santé dans leur plan de vérification, dans leur programme annuel ou bien dans leur plan stratégique de vérification. Le deuxième niveau, je le disais tout à l'heure, pour les ISC du CREFIAF, c'est que nous avons, il y a d'autres mandats qui arrivent quand je parle de jugement de compte. Donc il y a un pool élevé de responsabilités dont il faut tenir compte quand il faut commencer à prioriser le domaine de la santé. J'ai échangé avec des collègues tout à l'heure, mes collègues, et je leur disais, si on commence à prioriser la santé, d'autres secteurs viendront également. On va dire, il y a quelques années, il y a 5-6 ans, le CREFIAF a accès
how things are put in place. We have to pay attention to all that in terms of the challenges that we face. We also noted that the human resource management issue, we should put in place pools of experts, pool of auditors that are going to deal with the health aspects, and also talked about financial resources. We have access problem. If we are all here, it's just because we have to learn how resource management is done, look for resources. We need financial autonomy, but it's clear we really need it. It's quite obvious because we always come back to ask for a budget from the parliament. We don't have from the government, so we don't have an overall autonomy as such. That's a thing we have to dwell on much. We also talked about the work of the auditing work. The auditing work, the first item that I highlighted is to diversify the skills and competence in terms of expertise. We read the program. We have the financial audits. We have the programmatic audits. We have it sounds like performance audit. We also other types of audit, and we have to, within our various SIs, be able to train people in the variety of audits, and this have to be accompanied with practical exercises. There are a lot of SIs in Francophone areas. We trained a lot of people in auditing, but they didn't get to the practical part. We talked about many of them. They are ready to support our SIs in the practical field, and it's a huge challenge. It's another tool. That's the tool of the knowledge of your programs. Each program has its way of operating. Each program has its mechanisms of implementation, mechanism of accounts audits. I remember when CREFIAF is dealing with the African Bank of Development, we are informed about the procedures of the African Bank of Development, and this enables us to audit these programs. When you work at the World Bank, we do similarly. So there's another challenge that stands up is that these SIs should train themselves in the various programs, how. There are a number of items that should be taken into account, and if we succeed to do that, that will be a way of success, and we will move towards the same direction. And we have, let me come back to the mandate, but here I want to link up the partners' expectations and our personal expectations. Why am I saying this? Because we have our own mandates that are related to the organization of our SIs, those who put in place our SIs, our courts of auditors, gave us a precise mandate. Now, our mind is what now? Those who are here, it's of course relating to the different convention agreements that we sign with our partners. Now we need to reconcile the two ways, what we sign as agreements and what we get as mandate from our government. Try to see how they can marry. And we also have the issue of co-funding programs. The people come in our countries, they work on tuberculosis, TB, malaria, but they are not the only ones that fund for this disease, for fighting these diseases in our countries, and how to go about it when there are funds on malaria, when there are many players coming in, many donors who funded the various programs at stake. And then as SIs, sometimes we are told there are, of course, thematic studies, and we have to act thematic, and thereby you find a global fund inside. Gavi and other partners will find themselves in. Let's say, take about the fight against malaria. You're going to find many partners, many donors as well. So it's a too complex are very so complex that so many funding that are related to that diseases. We have another challenge that pertains to the mutual respect with regard to engagements. It's very fundamental. I heard people talking about deadlines. Some programs can be for 2-3 years, and if you have to wait to be given time, as we as SIs, this can be a hindrance to your problems, because we will take like 2-3 years to accompany you, but you find that due to this short deadline, we don't happen to support you. I have talked about the gap between the procedures, procedure disparities, and as sub-regional organizations, the CREFIAF, what is our main challenge? Our challenge is already how to value the teaching, the coaching, or what we have captured. We trained 3 SIs. Now what we do as sub-regional organizations, we have to replicate, duplicate, and bring others along. And this is what we need to strengthen the other SIs' competencies. This is what we do as a regional organization. We have another challenge that is related to direct access to donors. Don't understand it in a wrong way. You have to understand that we as a sub-regional organization, we have to get closer to you and not only always have to wait for waiting for the training of 2-3 organizations, but we try to see how we can put things in place and coordinate our activities for the welfare of the population. And we said it, we have to respect the principle that relates to the value, and this is for the citizenry. And this is as regards the opportunities. And regarding opportunities, the first one is it's taking into account taking the needs into account. How are we going to care for these needs in terms of opportunities? That, for example, leads to this signing conventions, agreements that are takes, and we tap on any opportunity that work, and we work together to attain the objectives, and an opportunity to snatch. And the considering various expectations. When I talked about different expectations, I said that is very important for the various partners, that when they plan, when they start their planning to facilitate the SI's intervention, they should integrate at least the SIs there which are going to audit their programs. That will facilitate in one way or another the programming of your programs in our strategic planning. And we already know that your program is going to take 3 to 4 years, and that on the 4th year we're going to need an evaluation, and you integrate the SA of the country that is going to do that work. They have signed the convention with you. They have already the obligation to be able to integrate and program your audit. These are mechanisms that can be taken. These are opportunities that can be tapped on to be able to get to the objectives that we set up. We also have capacity strengthening. We talked about the training of the stakeholders. We talked about the development of toolkits, and we talked about the development of the material that you have for SAI. AfroSAI is already ahead. They already have a number of materials that they have tested, utilized, and they have varied them, and they can share them with the CREFIAF zone. That's already an opportunity in place. They are already trained in different types of audit, and they can conduct the coordinated audits, and the CREFIAF does coordinated auditing, and you can now just implement the program in many countries at a go. And for a good support and for experience sharing, we can have coordinated tools in our sub-regions, and we can also, this of course will possibly lead to knowledge sharing, experience sharing, and knowledge. In technological aspect, there is a new scenario that audits are computer-assisted audits that are also in place. That's where I stop with my presentation. I had only 10 minutes.
Thank you very much, Krafiaf, for that presentation. I don't know whether there is any addition from AfroSai, in addition for that? Nice. No response means they're okay. And that leaves us to go to the next session, which will be quite involving, and we are going to make use of the food we ate. Yes, we have to ensure that it circulates well. So we are going to a session which is more of a combination of a World Cafe and a poster walk. And we are going to hear from SAI, or presentation from SAI on case studies of their work they have done, and they feel that you may learn something from their work. Basically, that's what we want to hear. And we are going to have 6 groups, or we are going to divide ourselves in 6 groups. To start with, we'll start with the presenters from the 6 SAIs. Who are the presenters? We had requested to have 2 people to present. For the SAIs, for SAI Zimbabwe, we have the presenter, and the madam. For Malawi, the presenters. Yes, I think I need to assign them where to stand now and start assembling your work, okay? Because we will walk around. We'll walk around. Let me assign them for Zimbabwe. I think this will be your territory here. From here, if you are displaying it as a poster, we can see how to pin it around. Okay. Yes, for Malawi, we can, you are doing it from a computer or okay, but I think we can, because of spreading, maybe you can use the table where Isaac is. Maybe you can just move there as I organize the rest of the group. Then I think I'll have to have a group here. That is Uganda. Yes, who is presenting? Charles. So you'll have people coming to hear from you. So you do it almost six times to be round. Good. Then near the door here, we are going to have the DRC. It will be you come and use this table here, or you have a presentation, you put it here. We'll see how to if you have a presentation, but if it's in laptop, you can just use here. Then we'll have one group in this table. That is which is the other one that I've missed? Tanzania. Yeah, maybe we can come. I'm trying to spread the group. We can come and use the person presenting. Who is presenting to the good? We can use this one. I think those are 5. I have missed Nigeria. Nigerian, I think, wow. We have a group there. Yeah, we can use this table. Yeah, not much. No, I think there will be interference. Yes, we can. Where do you think there's space? Just there will be a group here. We can use the stage. Yes, yes, good. Who is presenting? Good. Yeah, we can use the stage. Thank you. I think we'll be in that manner. If you can go there, then I can divide the rest of the people. I think we are going to take numbers, so that I don't direct you to this. The number will tell you where to go. Good. From number 1 to number 6. You represent. Who is presenting for your group? You. Okay. So you are number 1. Don't worry, I'll set it. Or maybe I can start it from here. Yes. Yeah. Number 1. Number 2. Number 3. Number 4. Number 5. Yes. Then let me finish this one. Number 6. That's group 6. Yeah. Then number 1. Okay. I'm here. Number 2. Then you are presenter. Number 3. Or co-presenter. Then you are number 3. Then number 4. 5. Who is the presenter? The co-presenter? Okay. Number 6. Okay. Then in this table, number 1. 2, Nikki, you are group 3, 4, 5, 6. You are number 1. You are group 2, 3, 4. Either you're in group number 4. Good. I hope you have taken note. Who doesn't have a group or a number? Good. Number 1 will start here with Zimbabwe. Okay. Just come, Isaac. What you are saying is very important. Yes. I've been advised that we have one group for the French for translation purposes. So, yes. Yes. That is, yes, that's one group. Yes. Yes. Yes, but I think I've been advised to make a change because of translation purposes, such that we have just the French group, just being in one group, so that we ease the work of translation. So I think I'll have to move them, and yeah, maybe we start again because I'll give them number 1. If you know you are a French speaker, then we are going to assign you as group 1. So can I have the French speaker just coming to this corner, because you'll be our group 1, then assign the rest. I thought there was translation, but I can be helped by. Yes, you can. you can say that for me, that the French of the French and Group 1.
Ok, tous ceux qui parlent français seront dans un groupe, le groupe 1, qui va rejoindre la RDC. Merci.
It's okay. They are not moving. They are not moving. I said it's an exercise. You have to move. Eh? You'll do a lot of walking. Eh? Yes. It's now I'm remaining to create with 5 groups. So if where are the French? Where are they? They are there. I can see them. I can see them. Yes. It is. Yeah. The exercise will involve everyone. Everyone will be involved in the exercise. Everyone is there to learn and hear the experiences from science. So we are going to all work. So I believe, okay, good. Good, thank you. Then from there, then let's redo it again. Yes. So number 1 to number 5. If I give you number 1, you are. Sorry, I start from 2, so that I don't confuse people. 2 to 6, Yes. If I give you 2, you are. Okay. It's agreed. Okay. They should mention number 1. Let them mention so that they remember. Yes. That's what. Let's start from here. Just say it so that. You remember, yes? Number 1. Yes? Don't worry. For you, the present, just move where and you'll be presenting. So you are number 1. I'm talking 1, 3, okay, then it'll be 4, 5, okay, 6, 1, 2, yes, 3. What is your number? 4. Christelle, your number 5. Yes, group 5. Yes. Sophie, 1, 2. Good. I think if you got your number. Yes, those are, the number that we have given you, that is your group. All right? Then I want us to assemble as a group. Yes, the one that I've taken number 1, we can, the new number 1 here. Yes, we can assemble here, number 1. So that, yes, the new number 1. I think she's you're number 2. Where is the other number 1? Oops. It will be very taxing. Yes, number 1, number 2s. We'll get them. Number 2s. Let's assemble here. Yes. Then number 3. Number 3s, number 4. I think number 5 and the number 5 will be there. So I think 1, 2, 3, 4, 5. I didn't give you. I was number 4. So yeah, 5. Good. Number 5 are there. Yes, where Nikki is. I still don't get the one of the number ones. Yeah, good. Join there. Here. No, you're number 2. Sophie is number 1, who is lost? Who is lost? Who doesn't have a group? No, we don't have the 6 is the French group. We have one group that is just French. Yeah. The Anglophone we have just given 1 to 5. Yes. No, he's a presenter. I think we can move. Just move where we are going to have the presentation. Yes. Yeah, we arrange them. I get you. Yes, yes. 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 The presenter for number 3 will get there. Yes. A table. Not necessarily. You don't need. Or you can use the podium. Let's use the podium. Kindly. So don't worry. We'll get interpreters for this group. They move up with this group. Wherever they're moving. They're moving, eh? They'll be moving. Several people will come here. This is the first group that will come here. The rest of the 5 will still come here. Yes. Just put it, we can just gather here. Because you'll explain. Yes, yes, then explain. Yes? And when this one is on, it is also on. Yeah. Where is the presenter for the group 2? I heard here Zimbabwe. There was a presenter to be here. Good, good. This is what we are going to do. In the group that you are in, get a rapporteur or somebody to report back to the plenary on what you are going to learn as you are moving around. So amongst yourself, just decide who will be noting whatever you learn from the presenter. We also anticipate that you're going to ask questions there. Okay? To learn more. Ask questions as you move around to learn the program or the experience the SAI will share with you. So let's have okay. Requested for translation. The people from DRC are requesting for translation. Yes, yes. Good. Yes. So what will happen is that we will walk around, starting from the group 1 will start with Zimbabwe. Then we will move in this direction, coming to where Uganda is. We will take approximately 10, the presenter, we anticipate you spend 10 minutes presenting, and then there'll be 5 minutes question and answers to hear from the people who are hearing from you. Then you're going to, after the 15 minutes, then you will move to the next group. That is the group, the French one. The French speakers. You go to. You find a presenter for Uganda. You find a presenter for DRC. You just move until we are through. Am I clear? We are walking around. I'm going to repeat. Now I have got your attention. Yes. When you say no, I like it because I've got your I get your attention. The presenter, the presenter is the one explaining your presentation. You'll explain your presentation. And since you are two of you, it will be one. We expect that your co-presenter will have an opportunity to allow you to present. Then they can be in another group. When we switch, then they can come and then you can go to another group. You'll be alternating. The presenters, you'll be alternating. Is it clear? The presenter will be alternating. We have two presenters. I'm going to use an example for this one, for this group. Angela from Zimbabwe will be presenting for this group. Then they're going to receive the next group that is coming after 15 minutes. Okay? Then you can switch. Because I'm anticipating when he's doing the presentation, you can go to another group. The co-presenter. The co-presenter, we want to ensure that everybody has an opportunity to go to another group. Is it clear? Or I repeat? The co-presenter, you are two of you. The co-presenter, when we switch groups, when another group is coming, one of the co-presenter can go with the other group to hear from a perspective of another group. Then when we switch, they can come back. Is it confusing? Yes? For you, but for others, I know it's not clear. That's for co-presenters. But for the others, you just be moving. Yeah, we will start with this. For instance, for this French group, it will start here. Then it will go to Uganda group after 15 minutes. Here, from the presentation in Uganda. Okay, have questions and answers. Then after 15 minutes, they will go to DRC. Hear their presentation, questions and answer. And I'm sure the rapporteur of the group is noting some of the things you are learning. Then they'll move to Tanzania. Okay? Then from Tanzania, they will come to Malawi. All right? And then, where are my friends? I skipped them. Ideally, this one should have come through Nigeria. Sorry. It should have Nigeria, Uganda, DRC. Yes? They'll move there. It's only the language. I'll move them there. Then Tanzania, it will be there. Then we have Malawi, where Caroline is. That's how we'll move. So everybody will have an opportunity to go to every group. Clear? Maybe we can do it when you are doing it and you are lost. We will guide you. All right? I think the best way is we start when we get fixed. We learn on the way. All right? Thank you. I think for DRC, yeah. No, it's not the presentation by RDC. They have a presentation. Yeah, but there's a presenter. There's a presenter like him. There is Uganda. There's a presenter for the group. Yes. Maybe you can assist me to because the communication. Yes. Yeah. They can be where. Good. I think we are set. We are set, So I'll be indicating when the 15 minutes are over so that we move to the next group, Yes, translators, please. For the French group is here. Yes. Sorry. Yes. Yes, you leave the presenter here. Yes, the presenter will be this is a Zimbabwe zone to explain about issues of Zimbabwe. Yeah. It will be there. There will be a different group. Yes. 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 Yeah. No. Yeah. One of them comes. No. There are two. But yeah, one can stay. It is true. You are right.
May I? I'm getting some requests from participants who are suggesting that to have right away presentation side by side. Yeah. Non. On vient de changer. On dit que.
They've just changed. They're saying that if it's possible, you can change a size. Moving people very difficult. Vous pouvez appeler un après.
Yeah, because no one has a poster, initially we were thinking that some size would have a poster, but we've realized everyone has a PowerPoint presentation. So because of that, then there's no poster work. So I guess we'll just do the traditional way of PowerPoints. Thank you.
stand on the existing protocol recognizing the presence of the Auditors General, representative of donor agencies, and the management of Aidspdan. Good afternoon. My name is Dr. Clement Ojile, Assistant Director of Audit, representing SAI Nigeria. This is our experience in the audit of Global Fund to Nigeria. Presentation outline, overview of the donor fund project we audited, percent was disbursed as at the time of audit. Now, there are 7 principal recipients, and the intervention area was HIV grant, which was given to NACA, TB grants managed by National Tuberculosis and Leprosy, then malaria grants. That was managed by National Malaria Elimination Program and Catholic Relief Services. Lagos State Government also participated in the malaria intervention area. So, what was the audit focus? The audit focused on the 3 billion grants to Nigeria and to effectiveness of the program, with emphasis on supply chain management. Audit approach. The audit approach adopted was result-oriented and system-oriented. A result-oriented audit approach assesses whether output objectives have been achieved or services are operating as designed. System-oriented approach assesses whether the people, process, and system are operating as designed. So we draw this from performance audit methodology, where any approach we are taking, we should be able to let the people know, the readers know, that this is what we are doing. Then we apply performance audit, performance and compliance audit method in bringing emphasis on evaluating the effectiveness, efficiency, and the sustainability of action. Sorry. Please, can you? Okay. So the standard, the audit was, hello, which one? Are you controlling from there? Sorry? What's happening? Should I control from here? Okay, so he controls from there. Okay, please, can you go back? Okay, thank you. The next slide. Next slide. The audit focus was on the Global Fund's 3 billion grants to Nigeria to fight HIV, malaria, tuberculosis. The primary objective of the audit was to assess the efficiency and effectiveness of the program with emphasis on the supply chain management. Next slide. Audit approach, we used a combination of result-oriented and system-oriented. Any of these two, you want to see whether the result is being achieved or the system is operating as it was designed to operate. Next slide. So we use performance and compliance audit method. Performance, they are focusing on the efficiency and effectiveness, and compliance, whether they comply with the best practices. And the audit made use of the toolkit. One of the capacity building program organized by Aidspdan was this capacity on enabling our team to know how to approach health products, because using the traditional audit method, we will not get the result we want. So they developed the template. First of all, they introduced us to the products. Because in programmatic, there must be product before you talk about a program. So we were introduced into the use of the toolkit before we enter the field. And then from the toolkit, you see the template where you, as you are entering the facility, you are making observation about the position of the pharmacy, the stop card, you interview the role players. The next slide. So the audit was conducted in accordance with international standard on supreme audit institution, which requires that the audit is planned in such a way that we will get sufficient audit evidence to enable us to make a reasonable conclusion. Next slide. Team members participated in this capacity building strengthening project held in Nigeria and Kenya, and the team members were trained on how to conduct programmatic audit of donor-funded projects. Next slide. Now, positive impact on accountability. Positive impact on accountability. In the process of audit, we discovered non-availability of essential drugs in some health facilities. We also noticed favoritism in the allocation of malaria drugs. For instance, in a pediatric hospital, we saw out of stock. In another hospital within the same state, we saw the malaria drug overstock. What did we do? We said, this is not good. Ministry of Health, you have to move these drugs to the next facility that need it most. This is not a good practice. We also notice unaccounted hot commodities. When you go to a facility, we go to a facility, we ask for bean card, debit note. From there, we could see unexplained adjustment. Balance brought forward to the next forward, it is not the same. So we raised such observation. Then protracted stock out. You will see being card for 3 months, there will be a stock out of essential drug. Again, that is evidence of the product not being available where it is needed. Again, it's an issue. Improper storage condition. We also noticed that in some facilities, the refrigerator, air conditioners are not working as they should. Again, we felt this will affect the quality of the product. So we raised that issue too, and we drew the attention of the Minister of Health and the recipients that were in our company to take necessary action. Next slide. Now, the audit team advised principal representative and the health facilities to move health product to where it was most needed. I gave an example of the Kano. Then the health facilities, they were happy with us. Oh, auditors can come, federal auditors can, they've not had it before. Initially, the health facilities say, what are auditors doing here? What do they know? They are supposed to deal with finances. So that enlightenment, letting them know that, auditors, it's not only finance, we are looking at the product and the movement of the product. So that then gave them some joy. And they are actually looking forward to another opportunity for us to visit their facilities. Minister of Health who accompanied the audit team appreciate the audit approach using the toolkit. So that was another plus for the engagement. Next slide. Lessons learned. So auditors who are traditionally trained to do financial and compliance audit are now experienced on how to conduct audit of donor-funded projects. 2, the toolkit supports working paper. You know, in every of our work, we are expected to keep working paper. So each of the stage we took, interview we conducted, every observation we documented it, and we advised, please sign with us at each of the facilities we visited. So we had first-hand audit evidence. Then our side actually prioritized financial and compliance, and there's no budget for audit of donor-funded project. It's one of our challenges. You know, we don't budget for gift, and that was the problem. So we couldn't undertake the audit at the beginning of the program, and therefore most of what we found was more of post-homo, so which is not good enough. So report of the audit does not get to the parliament to whom size primarily sends to. We are supposed to report to the parliament. But the result of that our work is on the website of Global Fund. It would have made better impact if it is addressed to the parliament. These are our findings. This fund granted to us, these are issues we are finding, for them to take corrective action. Next slide. Recommendation. Donor should engage with SAIS from initiation of project through its implementation. As you are signing the agreement, let the SAIS know. Let them have the template. This is what we have agreed. This will now form the audit criteria. Donor should include budget for audit of programs by SAIS, or require donee or grant recipient to make budgetary allocation to SAIS to conduct programmatic audit of projects as part of the grant condition. If this is made part of the condition, they will make budget for it, and the SAIS don't need to rely on the national budget, because the national budget may not come as at when due, as at the time the project is being run. So if there's such a plan, it will help the audit. We also advise that SAIS should seek support of NGOs like Aidspdan to train its staff to build their capacity to audit health products and programs. We thank God for we are beneficiaries and we are proud of it. So we thank Aidspdan and all the donors for giving us that privilege. We also say SAIS should include budget of donor-funded project in its annual audit program and send it to the parliament. Now, as you are planning, by the time you have been engaged from the beginning of any of the donor agreement, you know that you have a product to deliver. You know you have a report. The parliament will be willing to listen to you. So next slide. Conclusion. Enhancing accountability in donor-funded projects requires the collaborative effort of the donor, the government, audit institution, and the observers. While the donor is desirous of supporting health programs, the government owes it a duty to her citizens to ensure that the objectives of programs are met for the good of the citizen. SAIS will be seen to be adding value to the life of citizens if it reports on the performance of the programs. Next slide. Now, we have a common goal. Donor intervene in health projects for the good of the citizens. Government's business is to advance the health of the citizens. SAIS exists to ensure that resources benefit the citizens. Inside 12, making a difference in the lives of citizens. Aidspdan, ETC, desires to see that the common goal is achieved in an efficient and effective manner. Next slide. Collaboration is necessary. Next slide. On that note, I say thank you. It is all about people. God bless you all.
Thank you, Nigeria team. We are going to hear from Uganda. Welcome, Charles.
Good afternoon, everybody. All protocols observed, and welcome to the graveyard shift after a sumptuous lunch. So I'm going to share with you our experience in Uganda on auditing of donor-funded health programs. By the names of Charles Alumai. I'm an assistant director in the Office of the Auditor General. Next slide. Okay, so that is the outline of the presentation. I shall give you a synopsis of the setup in SAI Uganda, how we audit the health sector. And then without much ado, I'll just go straight away to 2 case studies, but I'll be brief to the point. So next slide. Okay, so I just wanted to pause a bit there. Now in Uganda, how we are set up in audit of the health sector is that we have the Ministry of Health, and then all the agencies under Ministry of Health, they happen to be 26, and then 7 projects, donor-funded projects, of which, of course, we've got Gavi, a global fund. There's a COVID project. We've got a World Bank project on Uganda government physical transfers program, which is constructing schools, health facilities, water, and the rest. And then also AMCHIP, that is Uganda Reproductive Maternal Child Health Services Improvement Project. And then Italian Support Health Sector Development Plan. So that is how we are set up. And what I wanted to show you this perspective is that inside Uganda, when we are auditing the health sector, we've got a privilege of having an eye-bird's view of everything that is going on, and we end up with the Ministry of Health so that whatever we pick up from auditing of what is happening on these health agencies, then when we're having a closure with the Ministry of Health, we can highlight what is coming up from all the other agencies. So I thought that was maybe important for me to share with you, but I'll now go straight away to the case study that I have. Next slide. Okay, so as indicated, I'm going to showcase 2 case studies. These are donor-funded programs, and one is the AMCHIP project, and then the other one is the UGIFT project. As you can see there, the UGIFT project, just to be brief, to give you an outline, is about construction of health facilities, education facilities in the entire government. And then the AMCHIP project is on reproductive maternal neonatal child health care services. So those are the 2 health funded programs I'm going to showcase. Without much ado, next slide. I'll give you the actual details in the next. Okay, so in the audit of those 2, to begin with, the objective for UGIFT was to assess the extent to which the local governments were implementing this program in delivery of the health systems. And the specific objectives in the audit of the UGIFT program, particularly with the focus on the health service system, was on economic assessment, was to assess the appropriateness of the project planning and implementation in terms of quantity and cost in delivery of the infrastructure, that is construction of the health facilities. Then efficiency assessment, we are looking at the level of implementation of the works against the agreed contract deliverables and outputs, that is in the construction of those health facilities. And then at the end of the day also, we also focused on assessing the usage of functionality, that is the usage and the quality of the works undertaken by these local governments. And of course, in terms of methodology, this was a value for money audit, which was in which we developed an assessment tool, which was agreed upon by World Bank. And in terms of assessment scores, economy, we had 30, 35, and 35% for efficiency and effectiveness. But what happens is that because we are assessing 60 local governments in our scope, we had to be able to rank the results. So that is the scope. And in this, we assessed 57 health care construction projects. And then next slide. So yeah, straight away, in terms of what were the findings in this first project that we assessed. One was that in the design process, in review of the design process requirements, the omissions noted inadequacy of the design processes for 39 local governments who were constructing health facilities. And then, of course, the broader implication is that omissions in design process lead to failure to undertake these geotechnical investigations result in inadequate designs that can ultimately lead to variations in the implementation of works and also affect the functionality of the structure. And then in assessment of the physical progress based on the initial work program, we assessed that for the 56 local governments, at the time of the audit, 35 out of 56 local governments had not completed their works on time. And out of the 35 local governments, 19 were awarded time extensions to the contractors to complete the works. So the broader implication of this is that delayed completion of work points to delayed commencement, delays in payments, and denies the users the timely utilization of the facilities and increased time-related costs and projects. And then, of course, again, on review of the payment certificates broadly, we found issues of accountability relating to overpayments of 122 Ugandan million. Again, the broader implication is that payments above certified works exposes the local governments to the risk of financial loss. Next slide. Yes, again, there was another key finding was the issue of failure to appoint project supervisors in overseeing these programs. And then again, the broader implication is that when you don't have appointed supervision personnel to supervise ongoing works, the issues of quality arises, leading to poor quality of works. And then, of course, we also observe several defects in terms of construction of these health facilities. And then the broader implication is that if this is not addressed, it has a high impact on operation and maintenance costs. And then lastly, there was an issue of non-adherence to the environmental requirements. 17 out of 56 had fulfilled the environmental requirements. That is the environmental impact assessment on implementation of these projects, while the balance of the 39 didn't. We can continue. Next. Then the other program is AMCHIP. It is the results, one of the findings. It's on results-based financing. It's also a program for results. And just in the interest of time, on execution of this health facility-based performance improvement plans, out of a total of 36 planned activities, the health facility performance improvement plans of the 47 sampled facilities were implemented, but the others did not implement. And the broader implication was that funds worth 997 were actually being spent on activities to improve service delivery, and the balance less 52 were not used on that. And next slide. Be quick. I've got a short of time. Next slide. Next. I want to go to the recommendations. Okay. So now when we come to UGIFT, our broader recommendation was that we recommended that to the account officers of the local governments was that prior to implementing of any infrastructure projects of similar nature, that design procedures and assessments need to be undertaken such that we don't have issues of inadequate needs assessment. And then to also ensure that the contractors submit their work programs detailing how they are going to execute the works to avoid delays, because the issue here is that we want these facilities delivered on time. Then regarding issues of accountability, of course, we recommended that all recoveries need to be made. And then for all defects and omissions observed, that is cracks on the facilities, we recommended that these had to be remedied immediately. And also we recommended that project supervisors be formally appointed to ensure oversight and supervision of these projects. And also one our broader recommendation was that to the project managers and supervisors, the environmental social safeguards need to be adhered to for the safety of workers. Next slide. So on issues of accountability, the broader impact is that having discovered a total of 2 billion on the AMCHIP project, this was flagged for recovery, and then 122 million for the UGIFT projects. Then for low absorption on the AMCHIP, again, we did recommendation that systems be strengthened. As you know, that low uptake of funds affects the extent to which the project objectives are achieved. Then on failure to execute planned activities within the project timeframes, again, that again has an impact to which the health program objectives are achieved. Then, of course, in terms of oversight, with these recommendations, there was an opportunity for strengthening accountability in terms of measures put in place to address compliance with the PPDA procurement regulatory framework and accountability requirements. And then, of course, the positive impact on other projects was that for the COVID project, that was program which was implemented, the lessons learned on accountability on these two projects, the Ministry of Health ensured that systems were strengthened in that. Next slide. And then on the broader impact on accountability on the Ministry of Health strategic objectives, the key aspect of addressing functionality and adequacy of health facilities. For the other program, which was on the construction of health facilities, that was a way in which we were able to point out the extent to which health facilities in Uganda were functional, and the ministry was able to take stock of this. And then in terms of strengthening human resources for health management and development in health programs, the findings that we obtained in the district in terms of gaps in absence of health personnel, recruitment, and training went a long way in terms of pointing to the Ministry of Health how to address those aspects. And then in issues regarding to misuse of funds, overpayments, and accountabilities, having addressed that was one way of contributing to the Ministry of Health's objective of strengthening health sector governance and accountability. And then lastly, in terms of ensuring availability of quality, safe medicines, vaccines, and consumables, in the auditing in the audit of AMCHIPs, particularly the aspect of coordination with the agency that procures these drugs and distribution of the arm chip commodities. That was one way of addressing the availability of those vaccines and those commodities. So the lessons learned are that we should prioritize regular ethics training for the audit teams and strengthen whistleblower protection mechanisms to encourage reporting on misconduct, and then engaging stakeholders from diverse backgrounds to help gain different perspectives on potential irregularities, such that there is a contribution to comprehensive and robust audit findings, given the holistic audit of all health sector agencies and ministries and projects. So basically, that is what I had for you. And just to conclude, in all this, we resonate with the Intosai in terms of contributing to the lives of citizens to make a better contribution to service delivery. I thank you.
Thank you, Sai Uganda. And next we are going to hear from Sai Tanzania. Kindly welcome to have your presentation.
Good afternoon, everyone. Yeah, all protocol have been observed. My name is Wendy. I'm Deputy Auditor General, responsible for the audit of the central government, including the health services. Well, our presentation will focus on those key major issues. I'll start with the background. The approach that we are using in auditing the health services, including the Global Fund and other donor-funded projects, the best practices that we are applying, what are the major findings that we have come across, and then the lesson learned and recommendations. Starting with the provision of the health services, according to the Constitution, the government has the responsibility of providing the services to the government, to the citizens. And the key pillars and these issues in the provisions, presence of the good governance, availability of the drugs, medical equipment, human resources, having the systems, financial systems, and collections and the use of health statistics, because these statistics are the ones that are being used, and making some decisions, as well as the involvement of the citizens and presence of the health facilities, the hospitals, health centers, and dispensaries. The number of programs that are being implemented in Tanzania. As you can see, we have the Global Fund, we have the COVID, the basket funds, and so on. These funds or programs are being audited in line with the ethics, because the CAG is the one auditing these funds, the programs, and we follow the existing ethics. We have the standards that we are using, the e-size, which is applied for supreme audit institutions, but also have the international ethics standards boards for accountants that we also need to follow them. We have the National Board of Accountants, but also as SAI, we have customized our code of ethics. So we all apply these ethics and standards while doing the audits. From the Public Audit Act, the CAG is mandated to hire the expert in order to ensure that the report that is issuing is in line with the standards. And why I have bring this, because we know health issues are somehow specialized, and for CAG to be able to come up with the audit that is adding value, remaining relevant to the citizens, he may decide to engage experts that are not in-house in order for him to be able to come up with a report that is adding value. We have some of the doctors that are being employed, recruited in the SAIs, but they are not enough to be able to audit the health services, because Tanzania is huge, you have a number of regions. So he sometimes decides to engage other experts to come up with a pool of audit team that can be able to audit the provision of services. Yeah, in terms of the audit approach, yes, we have the financial audit, we have the compliance audit, but also we have the performance audit. These are the methodologies that we are using, and we have the standards for them. We apply them while doing the audit. But having this programmatic, which doesn't have its specific audit standards, but there are some methodologies that for us, we think we can embed them through the existing methodologies that we're using. So we embed the programmatic issues, including the procurement issues and the supply chain issues in our audit that we do conduct. So the objective is to see or to assess the extent the services is being provided to the citizens, and coming up with a recommendation on what needs to be improved in order to improve the service delivery. The applied approach enables the identification of the area for improvement, hence promoting accountability and maintaining public trust. At the end, we need to remain relevant to the citizens. So that's also part of the approach that we're using. Is we do risk-based audit, and from that approach, we can come up with the areas that we focus on. At the end, we have the risk assessment 5, which is the document that come up with the areas that need to focus in the audit. So what best practice that we are applying, we're saying that as a means of enhancing the quality of audit in line with the stakeholders' expectations, the SAI, Tanzania SAI, has been providing regular training to auditors. Here I mean training on the financial audit, compliance audit, because there are financial issues that we need to look at when we are auditing these programs. So we want to ensure that our auditors knows well these issues, and consider the issue of ethics while auditing the provision of services. But also we do provide continuous education for them to be updated with the current issues that are in place. And we provide specialized training to our auditors. We thank Gavi and the Global Fund. They supported us. We had a training on, one was conducted in January this year, and the other one was conducted in July this year. The training aimed at equipping the auditors with the specialized skills while auditing the programs. We also use the work of other experts, to support our work, and we engage stakeholders through accountability forums. Just having a discussion with them, it's a focus group discussion, to hear from them and what are they saying. And some of them engage us, because yesterday we had some of the institutions that are providing the services. These are designated hospitals. They are designated hospitals and health facilities that are under the religions institutions, and they want to hear, what were the major findings that we noted while doing the audit, because they are given some funds to provide some service to the citizens. So through that engagement, to be able also to share some experience, listen from them, also getting the feedback from them on what we think can be done in order to improve the provision of the services to the citizens. But also we engage Tanzanians through we have this citizens report where we simplify our report. We know that these reports have some technical issues. Some of the citizens may not understand, and that basically cannot question the provision of the services. But so on that basis, we simplify the audit report in a language that can be easily understand, and being able to question in any area that they think they need an improvement. So that's one way of engagement of stakeholders. So we also like to share some key findings that we noted while doing the audit, and these are just a few ones because we had a limitation of time. Then we decided to come up with only this one, but we have some of them. The first one was relating with the problem of supplying the ordering of these drugs. We noted we wanted to check to what extent the ordering aimed at minimizing the wastage. And so when we look at the stock that they were in the warehouse, and noted there were some of the drugs that were expired. And what's the implication for that? It's implying that there was loss due to non-consumption of expired health commodities and non-attainment of the intended objectives. And we make a recommendation to the management to ensure that once they do this ordering, they have to take into consideration minimization of the wastage. And then the other issue focused on the documentation. We want to see to what extent, the implementers of the programs document the delivery of the medical equipment and the distributions. And we noted some issues, and where we came up with a recommendation on wanting them to ensure that there were good documentation of the stock that they have delivered, and even the distribution. And we noted the issue of insufficient planning in ordering. That one also linked to the first audit findings. and the issue of inadequate follow-up. Because the minister has the law of making follow-up and monitoring the provision of these services. So we noted some some weaknesses, and where we came up with a recommendation on wanting them to ensure that they do make a follow-up on the distribution of this. It was condoms dispensers. Yeah, as a lesson learned, the first one, we think we need to have a strategy because the subject is huge and it requires certain skills. And we cannot go, if we don't have the strategy, maybe we can have a strategy for 3 years, putting some priorities, and from the priorities we can come up with the areas that we can build the capacity of our people. So we need to go step by step to ensure that at the end we can cover a large number, but also we can come up with a pool of, first, the auditors that can audit, but also if we would also like to engage maybe the experts, we have a means of engaging them, because it also requires some resources, and through that we can be able to cover after a certain period, covering to a large extent areas that we think they are priority for ourselves, but also taking on board the needs of our funders, because we've heard from them. So I think we need a strategy. And with the support from AfroSci, because the AfroSci have been supporting the coordinated audit. I think our colleagues from Caveat, they've mentioned that. The AfroSci have been supporting the audit of illicit financial flow, as well as the audit of SDGs. I thought maybe from this subject, because the health issue is one of the areas that maybe we need to focus on. There's a lot of complaints. Maybe not all the money that is being allocated can be seen to the targeted beneficiaries. But if we can have a coordinated audit, that we can also share the experiences, coming up with a pool of auditors, champions that can support each other. I think we can at least go a certain step. But also, continuous training is unavoidable, and since the subject needs us to engage experts, and engagement of experts it requires more resources, so that also goes to the first one. A strategy is unavoidable. I thank you.
I don't know whether this is an afternoon or an evening. If it is an afternoon, good afternoon. Evening, good evening. All right. All protocols of the Assistant Auditor General. I'm here to make this presentation on behalf of the SAI. The presentation outline contains the usual things. We have a background which covers our audit focus, of the focus, as well as the objectives, the significance of ethical auditing for donor-funded health programs, the application of the best practices, the provision of impact, the positive impact on accountability, but also the lessons learned throughout the process which we have undergone in terms of auditing the health programs. In terms of audit focus, SAI Malawi has actually done, we could say, 4 audits. The first audit was actually conducted after the first training of Aidspdan in 2019, and the focus of the audit was on the sustainable utilization of healthcare equipment, which looked into issues relating to equipment for TB, like the gene experts, and also lab equipment, as well as other equipments that were helping in TB and maternity, including the solar panels and the like. The second one looked at utilization of COVID resources, and this was actually done after the second online training, which was a refresher course by Aidspdan. Then we have also done financial audits on Global Fund for the second year of this phase, and these 3 reports which we have actually said here have been issued, but they have not yet been made public. As we are aware, our Act requires us to table them first before we make them public. We also are conducting a financial and compliance audit for Gavi in terms of the vaccines, and this audit is almost nearing the end. We are intending to issue it before the end of September. So far, those are the audit focuses that we've done in the health programs. Generally, the audit objective for those 4 audits was actually to ascertain whether Global Fund's programs were managed efficiently and effectively, and whether they were being conducted, the programs were actually being conducted in accordance with the requirements laid down by the donor financing agreements, as well as the public financial regulations that we follow in Malawi. In terms of the benefit of having ethical audits, we're saying that Malawi, we ensure that we conduct ethical audits. We do this by ensuring that we follow the ESI 130, that's the code of conduct. We require that all auditors sign the Code of Ethics declaration and declare whether they've got any interest and the like. So these are signed at the beginning of the audit, and also as we are completing the audit, we also sign whether these have actually been complied. We exercise independence and objectivity in conducting the audits, as well as also we currently can proudly say that we have a substantive Auditor General in the House, having been without one for about 4 years. So this year, the President appointed one and was confirmed in Parliament. And I think we can give a hand of applause to our Auditor General, Mr. Thomas Makiwa. This is a very good stride for us, because we know if a SAI doesn't have an Auditor General, it brings so many effects, and sometimes we may not be trusted as a country. So having one in place, we are very much proud of that. Now, Conducting ethical audits have actually enhanced integrity, accountability, transparency, as well as value for money in promoting good governance as far as health programs are concerned, but also maintaining public trust and ensure that auditors' independence and objectivity is actually achieved. So by us encouraging our officers to conduct ethical audits, we ensure that we are objective, but also we are independent in the manner how we conduct ourselves at the premises of our clients. At the same time, conducting ethical audits have actually enabled fair promotion of fair resource allocation in terms of ensuring that the health programs are actually doing what they are supposed to do. For instance, in the audit of COVID, where we try to find out that some of the COVID supplies were not being distributed as per the quantification that was supposed to be with regards to the assessment of the needs of the health facilities as presented in the DHIS2, which is a health system. So with that, by coming up with the recommendations, it will ensure that the Ministry of Health be able to use the information in the DHIS2 to determine the needs of the facility, which will aid in the procurement as well as the logistical distribution of these resources, of these health items. It has also helped in minimizing fraud and corruption. The presence of the Auditor General in trying to look at these supplies and the programs actually scare away the people who had probably intentions to do any malpractices. Usually when the AG is in place, people know that things might not go well due to the fact that we do comprehensive audits. In terms of application of best practices, this one, as per the template, required us to talk about the ethical standards, whether they were evaluated, those of our client and the PIU. We would say that we did not conduct that one per se, because we are yet to do that as one of the subject matters that would be followed in an audit. However, we conducted an extensive review of the financial and procurement policies and procedures, which aided us to come up with the assessment criteria, both in the performance audits as well as in the compliance audit, where we're coming up with the authorities that were being used to assess the issues that we're finding on the ground. But also, the teams that we used to conduct these audits, we made sure that all of them had actually received the specialized training on the ethical consideration in health programs. During the training that Aidspdan was providing, they brought in experts from the health facilities, but also from the ones who are managing these programs, and they enlightened us as to what ethical requirements are supposed to be upholded by the people who are running these programs, as well as the people in the health facilities as far as service delivery is concerned. So all the auditors were taken through the ethical considerations. However, during the audit, our focus was not mainly on the ethical considerations to find out whether they were adhering to those ones, but rather we focused on the issues of the supply chain management, the asset management, but also the management of the drugs and the vaccines. We have not yet engaged stakeholders to gather perceptions and feedback on the audit entities' ethical practices. We are thinking that this is one of the areas probably we could look into to enhance our audits, because once you get whistleblowers from the community, but also once we engage the communities who are the service beneficiaries, we would be able to get sufficient information that would lead to a much more comprehensive audit that would help to bring about improvement in the way and manner how these programs are being managed. In terms of impact, the audit did not actually discover any malpractices, by the ones who are managing the programs, but rather we observed issues in relation to procurement, and this included cost overruns, but also delays in the implementation of the projects. For instance, in the implementation of the COVID infrastructure projects, we could see that there were delays in actually constructing those facilities that were supposed to be constructed in various districts. However, COVID was actually one of the things that was actually moving fast beyond the actions of the programs and the Ministry of Health in order to combat it. In terms of cost overruns, we would find out that the budgets that were meant to be used for implementation of the various projects were actually overtaken with passage of time, and with the issues of inflation and devaluation, there were some cost overruns. So we're able to observe some of those things. But with regards to any misconducts by the PIU or the PR, those were not observed. The SAI's approach to auditing has strengthened accountability in the management of the programs. What we're trying to say is that with our coming in to audit these programs, we have noted that there will be some kind of strengthening of accountability, considering that once we issued the reports, when we communicated them to the PIU already started implementing the recommendations by following up on the health facilities to check on the weaknesses that we had found out, on the inefficiencies that we had found out on the program. So as a result, we believe that this will strengthen the accountability in the management of the programs. We had some lessons learned. Considering the issues that we observed on the ground, we thought there is need for improving coordination between PIU and the health facilities in order to improve efficiencies in program procurement and their implementation. Why are we saying this? We noted that drug quantification and proper needs assessment of what the health facilities needed was not actually communicated to the PIU to form a basis of their procurement. We noted that this was due to lack and poor coordination. Hence, the recommendations that there is need for a proper coordination to be able to guide the procurement of whatever supplies that are needed to address the issues that the programs are actually aimed at. We also noted that there is need for diverse stakeholder engagement in the audits of the programs in order to enhance the results of the audits as well as the quality of the audits. Further, we also noted that there is need to consider engaging citizens during the audits as they form part of the value chain and they lead to comprehensive and robust audit findings. This is what we thought we should share in terms of our experience as SAI Malawi with auditing the programs and what we have focused so far after we have begun this journey. Thank you very much for listening. Zikomo kwambili.
Good evening. All protocols observed. My name is Angela Nyangani from SAI Zimbabwe, and we're going to do a presentation on enhancing accountability in donor-funded health programs. However, my presentation is not going to be looking at a particular donor-funded project because we are currently finalizing the Global Fund report. But we're going to share with you the experience that we have had with audits of Ministry of Health and Childcare. Okay. So we're going to share with you the audit of the Health Services Fund under the Ministry of Health and Childcare, covering the provincial, the districts, and rural hospitals that we audited. The Health Services Fund mainly looks at collecting administration fees for hospitals. It looks at supplementing the health budget for both recurrent and capital expenditure. And also it looks at maintenance of health services, programs, and related activities. The audit focus. Our audit focus was assessing the effectiveness of financial management, compliance with health management rules, regulations by the hospitals in service delivery. And the focus areas were governance issues, where we were looking at maintenance of accounting records, the internal controls, the governance structures in place. We also looked at revenue collection, management, and debt recovery, because they are also responsible for collecting fees for hospitals. We also looked at management of assets, where we are looking at the infrastructure, the adequacy of the infrastructure, and the equipment in hospitals, and how they are managing them. We also looked at procurement of goods and services. Here we were focusing on compliance with the procurement regulations that they. Then we also looked at service delivery. We're looking at the financial staff, the pharmacies. We're also looking at stock management, the issue of stock outs, overstocking, how they record the disposal of drugs when they have expired. And in terms of the significance of the audit was there to promote accountability, transparency, ensuring effective service delivery, promoting confidence in the health delivery system. Then the practices that we used, or the best practices that we applied. Teams were trained on how to conduct the audits. And we did this during the planning phase of the audit. We reviewed the existing accounting officers' manuals and guidelines at every station. And staff were trained on using the guidelines. We also reviewed the effectiveness of internal controls, compliance with financial and non-financial regulations. We were looking at the WHO guidelines and the customized guidelines for, especially with regards to storage and disposal of expired drugs. We also assessed the existence and servicing of hospital equipment. These best practices are also applicable for donor-funded projects. You need to know the regulations, the guidelines, before you embark on an audit. Positive impact on accountability. What we noted as weaknesses. We noted that there were non-maintenance of financial records by the different hospitals. We also noted that there was inadequate infrastructure and hospital equipment. There were also key vacant positions, especially when we looked at the nursing staff. Those that were manning pharmacies would note that some of the pharmacies were being manned by interns. We also noted that there were delays in disposal of drugs. There are certain guidelines which they should follow when they are supposed to dispose expired drugs. What were the improvements after the audits? We noted that staff was now being trained, especially accounting staff. When we went out, we noted that accounting records were not being, accountants were sent for training. the gaps that we noted, especially for those that were in pharmacies, where interns were being used to man the pharmacies, they were also sent for training. Then when we looked at adequacy of infrastructure, and we noted that some gaps, we have noted that they have started acquisition of ambulances where there were some inadequacies. The reason why there were some key vacant posts and they were not being filled is because government had frozen the recruitment of accountants and also of nurses. So after our report came out, government then they opened up recruitment of the accounting staff and also of nurses so that they could close the gap for the key vacant positions. We noted that hospitals had also started addressing the causes for the delays in disposal of expired drugs. Most of them, they were saying there were no committees that were sitting to decide on or to conduct a board of survey for the expired drugs. So after the audit was carried out, we noted that board of surveys were then set up and they had started the process of disposal of drugs, of the expired drugs. Then influence on other projects. After completion of our audits, we noted that even for the other projects, the donor-funded projects, there was a marked improvement in terms of maintenance of documents, because those that are responsible for maintenance of documents under the House Services Fund are almost the same persons that are responsible for managing and also maintaining the records for the accountants. So after our recommendations that people were failing to maintain accounting records because either they lacked the skills, they were trained, and this now has a positive impact on the donor-funded projects which they manage. In terms of inadequacy, in terms of infrastructure, we now note that when the Ministry of Finance is coming, of Health is coming up with procurement plans, they now include some of the gaps or some of the assets that we noted and recommended that they are now inadequate, they are dilapidated, they are now included in the procurement plans that they then submit. So the inclusion of some of the assets in the work plans and procurement plans is based on the gaps that we noted during the audit. So the audit helped in identifying the gaps which are now being addressed by some of the donors that come through Ministry of Health. Then in terms of delays in disposal of drugs, we now note that even for global fund audits, where they are supposed to maintain some drugs, where they have pharmacies, some of the recommendations that we provided under the Health Services Fund, they are now using them to address gaps that we may now come across when we are auditing global fund audits. Then in terms of lessons learned and recommendations, when we conduct the Health Services Fund, we go out to the provinces, to the districts and rural hospitals. These are part of the field work that we do. And we got to understand better why some hospitals fail to maintain financial statements. Because when you get to the ground, you interview the person who's preparing the financial statements. What qualifications do you have? Were you trained? But if you do the audit at head office, you will never get a chance to interview the person who's doing the work. But if you go to the ground, you are able to interact with the person, get to understand their challenges, and come up with the correct recommendations. For example, with regards to non-production of financial statements, we noted that it was an issue of training, and we recommended properly, and the people were then given the necessary training, and there has now been an improvement. In addition to that, we noted that some of the root causes needed to be revisited. when we came up with findings, sometimes you find that the finding is not really addressing the root cause. And that is why some of the findings keep recurring. So this is one of the lessons that we learned during the field visits and also during the Health Services Fund, that when we come up with correct root causes, the findings are implementable. But if we miss out on the root causes, you'll find that the finding may keep recurring because of the absence of a correct root cause. We also learned that some of the findings, besides the inappropriate root cause, some of the findings keep recurring because either there's lack of resources to do the implementation, or there's no one or there's no mechanism in place to follow up on the implementation. These are some of the things that we then noted during compilation of our reports and also through the follow-up audits that we do. We also learned that when we do an audit as different teams that go to different provinces, there's need to come back and share ideas and give each other feedback so that we improve on future audits because of the challenges that we could have faced in the different projects or in the different provinces, or because of the challenges in terms of the questions that we'll be using. So this is something that we learned and that we also implemented during the audit of the Global Fund projects that we did. That when we go for provincial visits, we should come back, regroup, identify the challenges, and way forward for addressing those challenges in future. Then in terms of recommendations, we recommend that we need a SAIS to look at the root causes analysis. If we are having problems in having the findings addressed, there's need to look at the root causes. Are we identifying the root causes properly? I know with programmatic audits, it's easier to identify root causes if you follow it through. So this is one of the recommendations and one of the lessons that we got during the Health Services Fund audits. Then we also learned that we need to carry out audits on revenue generation to assist in resource mobilization strategies. Remember I said the Health Services Fund is there for collection of hospital administration fees, which are used as part of a supplementary budget to the one that the ministry gets. So following the training that we got on Monday about resource mobilization, if you also carry out such audits and look at how they are mobilizing resources, we can also better recommend to the hospitals on what they can do to improve their resource mobilization strategies. We also recommend that follow-up audits be done, be it interim audits, to check on progress in addressing prior year findings. If we wait until next year to do another audit, you may find that our audit may lose value. But if we are to remain relevant and add value, we need to follow up on the implementation of recommendations. And we can do that through follow-up audits, or we can do that through interim audits. This is what we learned, and this is what we are trying to implement in our SAI. Thank you.
Please put on your headset, because now I'm going to speak in French. First of all, stand up, please. Could you stand up for a warm-up? Stand up, please. Ladies and gentlemen, stand up for a warm-up exercise. You're going to write your name, your first name, all your names with your head. So use your head to write all your names. First name, surname. Let's go. Let's start. Write your names with your head, please. Start by your first name, then your family name with your head while standing up, please. Okay, great. Now with your lips, use your lips to write your names, please. Now with your lips. Thank you very much. We are going to give you our presentation, the presentation of DRC. Right. DRC has 26 provinces, as you can see. We have SAI, and in each province we have a provincial SAI, given the big size of the country. So it is impossible to manage everything at the central level in the capital city, Kinshasa. That's why it is decentralized at the provincial level. So the general, health inspectorate or the side for the Ministry of Health. It is a good governance support structure under the Ministry of Health. It supports the Ministry of Health in his oversight role, but also in his recurrent functions regarding the supervision of different structures and organs. It is under the authority of the Minister of Health. However, this is also the organ that carries out surveys, audits, and also sanctions were relevant. So that's all about its functions. So it is an overall auditing office of the entire health system, and the health system is represented by what we call the health house. The health house has three components. The first component, it is governance, everything regarding laws, guidelines, all the regulations. That is the foundation of this health house, the one you can see there. And then we have also revenue or income generation. It is the second component. So we have financial resources, we have human resources, and we have also material resources. And then we have health information system. And then where we use all these resources, that is the third part, this to improve the population's welfare. So we would like to underscore the fact that the side of the health system aims to improve the welfare of the population. We are not a financial auditing institution, but we are a health system auditing office. Now, what is the current situation of our health system? So the picture you can see there, it illustrates clearly a pipe that in fact convey water and all the resources to the entire population. Unfortunately, as you can see, there are many leakages. So all the water, all the aid, all the funding does not go up to the population. There are too many leaks along the pipe. And what is still dramatic is that actors have three attitudes. Some, they see, they just observe, they keep quiet, they don't say anything. There are also those who pretend not to see, that is the monkey at the middle, they just pretend not to see anything about these leakages. And there are the other monkey which refuses to listen to the population. And we're saying that we don't see anything regarding all the funding that are channeled in the health system. And based on our text and regulation, we came up with intervention strategies. First of all, it is mentoring. When we are carrying out our missions, we do not punish immediately because in fact it's about people's lives. We first of all mentor these staff members to tell them this is not the way you should work, this is not how you should manage. We carry out audits, we carry out also investigations, and we carry out audits that result in sanctions, because when someone has embezzled, you should not take him to the church. You have to punish him because he has embezzled public money. So briefly, that is how our inspectorate, our auditing office is structured. Now, we organized a workshop in Kinshasa because we didn't understand clearly the global fund financing or the Gavi financing. We didn't know by which door to enter to control structures that receive these fundings. Then, thanks to the workshop organized by Aidspdan, we have understood the importance of always linking programmatic aspect to the funds received and how to use it in the audit. Before, we didn't have that link. We were just focusing on money. But what does this money do? Concretely, what has been planned, what has been done, what has not been done as planned, why it has not been done, why did we have too many drugs that expired? So we try to identify the different causes, and then we can understand, no, there was an issue with the staff, maybe an issue of transport from one place to another, or maybe there is a poor quality of all the staff, doctors and nurses working in the sector. Now, at the end of that training, we came up with a roadmap. So, thanks to this roadmap, we have been able to identify problems and to propose solutions so as to be ready regarding the funding of Global Fund, Gavi, and regarding the 3 diseases. We didn't have a consultation framework between the national institutions, a national oversight institution, that is the auditing office, the court of auditors. So we thought we should have a framework for all of us to work together, because even if the General Inspectorate of Finance and the Court of Auditors should work to control funding, there are aspects that are related to the health sector which they do not master. So it was important to work together. Then we put in place that framework, and then also we observed very weak involvement of these institutions, but also insufficient material resources and logistic resources as compared to the needs related to all these activities. And there was also lack of transfer of skills towards auditing institutions. So we said that the Global Fund should support us in terms of a transition plan for skills transfer or competences transfer from the financial institution toward the National Auditing Office. Of course, Gavi have brought financial controllers, but there is still an issue, because usually they come to the Inspectorate General of the Health Sector to see why there is no improvement in terms of health outcomes regarding the funding that has been provided. We only have one recommendation, given everything that we have learned this morning. So we request that Aidspdan should continue to support us by the Rwandan auditor, because they are neighbors, given the languages, though they speak English, and given their experience, if they can support us, so that we can improve also our skills in terms of auditing World Global Fund and Gavi. Thank you very much for your kind attention.
Thank you all for those wonderful presentations. I think we had reserved, we said that we have a question and answer at the end. Are there questions? Kindly bring them on then. Okay. Lots of questions. I think this is an ongoing engagement tomorrow. And we have a session also for size. Yeah? I think we can, I would suggest. Questions? 5. Okay, there's a suggestion that we take 5 questions. Yeah, 5 questions. Yeah, 5 questions, not 5 people. Can ask one. Go ahead. Okay, go ahead.
I do like the journalists, they combine 3 in 1. Okay, let me try. So, no, thank you very much for the presentation. It was very, very enlightening, and I think most of what we heard are good. But I think in summary, for me, I'm looking again at we donors and some of the requirements we have. And the first question, well, I only have one, but let me try to group it, is as you go for these audits, is there a way that we can influence the terms of reference of your audits? So for me, that is one key question. And what will be the timing that we may have to do that to make sure that those terms of references are considered as part of those audits? I saw so many recommendations and they were brilliant. Frankly, chapeau, like we say in Francais. But there is one angle that I think may block us. And the angle is this. As auditors, do we work with the implementers or the ones responsible for implementing those recommendations, for them to know their responsibility as part of those recommendations? Do we cost or make an analysis with them as to how much it's going to cost, or if it's really feasible to do some of the recommendations we have? Because they are important, excellent recommendations, but do we go that extra mile? Or we write the recommendations and we say, this is what we found, Oga, na your wahala. Sorry, my Nigerian. So you see where the thinking is going with we donors, that recommendations, implementers, they have 1,001, if not more, from our routine recommendations that we give them, plus audit recommendations, plus other things. So how can we facilitate their lives, really, to make sure that whatever we are recommending, if it's that important, that we also work with them on how to get it done. And I love what our colleague from Zimbabwe said, because I was just telling Eric, the follow-up audits. Now, if we are going to put recommendations and we don't put timelines, or we don't go back as soon as we can, and it's all linked, because if you put out the recommendation and you agree on a planning mechanism to implement those recommendations, and you come up with a costing plan, and you come up with a review plan, then the whole cycle meets, right? But if we just recommend, and we say we finish our job, the rest is up to you, and we'll come and check, I think there is a missing link in between that. And I think what we would like to hear, and as we knowledge share, and we want to work together, is how we can work together as part of all these initiatives we are having with AfroSai, Aidspdan, and CREFIAF, to really address this important element.
Because if we don't do this, we can train so many auditors. We can capacitate you every month. But we'll come back and meet that all the recommendations you gave from 5 years ago are still waiting for us. They will be waiting, and you can do your aging analysis of some of the recommendations you have. It's not a secret that there are some that are still waiting for many years that have not been recommended, that have not been implemented. So I think we need to work together to see how we can move the needle. We agree it's a journey. But if there are some examples on how you have been able to address some of these things, really. And when I talk about some short-term quick fixes, which would really, and I was chatting with Eric, we could really support quickly or come in and help. These are some of the things that we see value immediately. And we can really come in and help. So I know it was one question. It was one question, boss, but it had different branches, but it's all packed, yes. Thank you very much.
Thank you. Maybe we can get a response. Yes, I see from Nigeria.
Okay, the response I want to give quickly is the issue that Charles has raised, influencing the TOR and what time. Yeah, is possible, and that brings me back to the first suggestion that I made. You know, if there is a strong coordination at the level of Global Fund Global Fund Gavi on maybe somebody, maybe a secretary or whatever that is focusing on these audits. Within that area, their TORs can be modified, you know, as it evolves, because when you start, by the time you get the inputs of the auditors, you continue to modify until you perfect the system. Then secondly, these recommendations can still be monitored, because if an auditor is engaged for an audit assignment, external audit assignment, after writing the report and giving its recommendation, it is left with the system, either the CCM, the Global Fund, the Gavi, and all the bodies that are involved in ensuring that those projects or programs are, you know, done effectively, to follow up on that implementation. And if you have somebody who is saddled with that, either in CCM or Global Fund, they can develop an audit recommendation matrix, which will be used to monitor the extent of implementation of auditors' recommendation. Then in the next cycle of audits, it is now left for the auditor to review the recommendation of the previous years and report on the extent of the implementation of the audit recommendation. It becomes part of what the external auditor is supposed to, you know, report on. Thank you.
Thank you. So Nigeria, a reaction, Uganda?
Thank you. I would like to also give maybe a response and also some maybe food for thought for Global Fund and Gavi. Now, I hear my namesake very well of Gavi. And now, specifically, when you talk about the extent to which the recommendations have to be implemented, the first thing is in the audit design, because oversight and audit of these programs is based on the objectives and what these programs are supposed to do. Audit basically is asking, and then we go on to ask, why is this happening? So the key issue on recommendations is that if you have recommendations on the root causes of the problem, then those recommendations shall not be actionable. When you, with the experience of auditing any funding system, it basically revolves about 3 areas. One recommendation may be on change of maybe the structure systems. Now that will not happen overnight. The other is about maybe the law and legislation. So until a mandate is changed, that will not change. Then of course the others you expect to be implemented. But just for sharing experience and concurring with you that we need to have mileage on this, as a SAI, we have developed what we call the ART, that is the Audit Recommendation Tool, whereby we have mapped out the extent to which these MDAs have implemented these recommendations, and we are producing a report to escalate now to Parliament so that there's an uptake there. So that is my experience on that. But now the second one that I have specifically to Global Fund and Gavi is that through the experience of auditing the health sector, interaction with the permanent secretary Ministry of Health is that if you focus more on prevention strategies, you save a little bit much more than on control. Of course, for Gavi, it's a different case because you must vaccinate the children. There's no way about that. Continuous. But now when I talk about Global Fund, with the three disease interventions, malaria, HIV, and TB, if you take a look and assess also the change, assess the extent to which the country mechanisms are focusing on prevention strategies, I do believe much more will be saved. I'll give you a personal example. When growing up, malaria was my nightmare. But over time, I got immunity to the extent that when I'm going maybe to sleep in a hotel, the first thing is in the room, is there a mosquito net? That is at all an infection, in mosquito-infected area. Now that is to do, of course, with the personal experience. So, of course, the bottom line I'm saying is that prevention also as a strategy is very important in terms of contribution to good health care in not only our specific size, but in Africa. Thank you.
Thank you, Charles. Maybe we may have just one more reaction. Tanzania.
Okay. Thank you very much. I wanted to respond to Mr. Charles on the issues that he has raised. In Tanzania, when we are auditing, of course, we are guided by ISAI and ISA, but we are also taking into account of TOR. Therefore, stakeholders' expectation and requirement is also our priority. Just to justify this, we have TOR for Global Fund, where the financial statement is a special purpose financial statement under income and expenditure account, as well as notes and statement of PUDR. So we are always on top of the game by taking into account of stakeholders' demand. Therefore, it is part of our audit. When it comes to the implementation of prior year audit recommendation, unfortunately, we couldn't present everything that we are performing in Tanzania, but we are also ahead of the audit, especially in the Global Fund, where we have been doing this.
In the design of these TORs, but I would like to touch a question that was asked by Charles. I think I understood it in a way that we should say, is there anything that we can do to be able to help and support in the implementation of these recommendations? And I felt like up to now we haven't really answered this worry that he gave us, because it's a hand that is trying to reach us from our partner to be able to in this area. So internally and in our country, usually the recommendations is more on stakeholders like parliaments to whom the government is accountable. And usually the size will bring the recommendation to the parliaments.
From Nigeria, that is Uganda. Yes.
I just wanted to add on what the previous speakers mentioned about the recommendations, because if we are to go with the systems that are in place in our countries, it means that we are going to, when we write these reports, we submit them to Parliament. And it's usually up to Parliament to decide when they will discuss the reports. And that is when you see entities, for example, taking up recommendations. In our country, we have a problem where Parliament takes forever to even discuss the value for money reports, where we usually put these recommendations. So if for example, the donors task the implementing entities, in this case, it could be Ministry of Health, to give an update on the recommendations every year for the prior year as a condition for them to be given funds in the following year, so that we don't only depend on government or only depending on us as size. Because as size, we can only go that far. We will not, it will be hard for us to force, for example, Parliament to discuss a certain report. But the implementing entities know, if they know that for them to be given whatever funds that have to be given for implementation for the next year, they have to give a comment or an update on the recommendations that were given by the Auditor General. You as a donor, it will be easy for you to get that kind of response from the implementing entities than to wait for the size. Thank you.
I think there's Nigeria.
All right. I just want to say this. In every audit, there is the owner of the report. When you commission an audit, the owner of the report is the person you submit the report to. The owner of that report is the person who is supposed to implement the recommendations in that report. How does he implement? In the private sector, you give to the shareholders. The shareholders at the annual general meeting take decisions on what they want to do. In the public sector, you give to the national assemblies. The national assemblies refer it to public account committee, who beckons on to the ministries and agencies and report at plenary and make recommendations to the president. This money are owned by the donors, and you are donating it to the government. There should be a mechanism between the donor and the government to ensure that the recommendations of auditors are implemented. The auditors can only go to the extent of recommending. We have seen this, we have seen this, you have not done this right, you have not done this right. And the donor has a hold on the implementing agency. If you fail to do this, we will stop to give you this. And there should be a mechanism between the donors so that there be maybe like a secretariat, like he recommended. If there is a high up somebody there who can always write, by the time the donor gets the report, you don't write to the implementing unit. There is a minister for health. There is a permanent secretary for health. If it is an agency under them that has done this thing, write direct to the accounting officer, which is the PAMSEC or the minister, telling them that we as donors, these are the reports you have gotten from our auditors. And we expect you to do this and this and this and this. Otherwise, in the next dispensation, we will not disburse our funds to you. That will solve all these problems, sir. Thank you.
Thank you. Nigeria. I see no more hands, means... You want to react to that? Charles? No, okay. Thank you. Thank you. I think we can go on with this kind of interaction, and I see how engaging we are already. To the extent we don't realize, actually we have consumed all the time that we had set for the afternoon session. So with that one, I believe that marks the end of that session. But we can take over that discussion tomorrow because it's a very important discussion. That's why we are here, to engage various stakeholders to lay their issues, and we kind of have a common understanding by the time we're coming out of here, and forge a way forward on how we are going to work seamlessly as we move on. With that one, I thank you for the session. I don't think we have anything much for today. Yes. From here, we take a coffee break. After that, then you are free to leave at your pleasure. You are, yes. Then we meet tomorrow.